Hello and welcome to the final day of the Research to Practice Transit Symposium. I am the host for this day. My name is Chad Riding, and I work in Caltrans, California Department of Transportation, Division of Planning and Modal Programs Management. As you can see, this event is sponsored by our colleagues at California Department of Transportation, American Public Transportation Association, University of Florida Transportation Institute, the UC Davis Transit Research Center, and the Mineta Transportation Institute. We have a packed agenda. You can find the program and the full schedule for today and for previous days at the website, which can be found here. We will start off with an in-depth session about women in transit, which reflects today's theme of transit equity. That session will be followed by a 15-minute break and a panel session on disability and transit. And then we will have another break followed by the closing plenary with Christoph Spieler. Thanks to everybody who participated in the steering committee to organize this symposium. Special thanks to Caltrans employees Wendy Moran, Caitlin Chikansky, and Heather Anetto for producing the graphics and for producing the communications. Thanks to all of today's participants. Without it, of course, this wouldn't have been possible. For those of you that are members of the American Institute of Certified Planners, this event is eligible for certification maintenance credit. You can find it at the website here. If you have any questions, experience technical difficulties or other things, please feel free to email me at chad.writing@dot.ca.gov. Thank you. Just wanted to quickly go to the symposium website. Again, the previous day's feeds are available on the website, as is the schedule and the full program and speakers. And again, for those of you who are AICP members seeking certification maintenance credits, this is the website. To find us, you can go to this link here, or you can search for us under Research to Practice Transit Symposium. So I'm going to go ahead and turn it over to the session's moderator, Hillary Nixon.
Thanks so much, Chad. So welcome, everyone. It is great to have you here for this session on day 3 of the Research to Practice Transit Symposium. My name is Dr. Hillary Nixon, and I am Deputy Executive Director of the Mineta Transportation Institute at San Jose State University. I also serve as chair of the Transportation Research Board's Standing Committee on Women and Gender in Transportation. So today's topic is of great interest to me. So this session focuses on the topic of women in transit, primarily from the perspective of how research can inform improved transit planning and service delivery, but we'll also shed some light about the transit workforce and how to do a better job of attracting, retaining, and promoting women in transit. We are going to start the session with 4 presentations from experts in the field. These presentations cover a range of topics, from helping us to better understand women's travel patterns and why we need to take this into consideration for transit planning, as well as specific efforts from different agencies such as LA Metro's Gender Action Plan and research in partnership with WMATA on how we can use fare card data to reveal specific travel patterns, particularly around the idea of mobility of care. We will also bring in an international perspective and learn about research in Chile that looks at women's travel patterns, again, with an eye towards a mobility of care. After the presentations, we'll bring all of the speakers together for a panel discussion to further explore how their research informs practice and to dive a bit deeper into this important topic. I have some questions for the panelists already set up, ready to go. But again, as Chad mentioned, if you have any questions for the panelists, please do email him, as he noted in his early opening remarks. So let's jump right into the presentations. We are going to start with a presentation from Dr. Emily Grisey on understanding the public transit patterns and needs of women. Dr. Cruzet is an assistant professor in the School of Urban and Regional Planning at the University of Alberta in Canada. She is an expert on the public transit needs of women and persons with disabilities. As our first presenter today, she will launch us into this topic area with a presentation that frames the issue with some general background on women's travel patterns and why it is important to understand these patterns as we think about transit planning and service. Emily, thank you so much for being with us today. I will turn the floor over to you.
Thank you so much for the introduction, Hillary, and for the opportunity to be here. It's such an exciting panel of all women, which is such a great opportunity. As Hillary mentioned, I look forward to starting off today's session with a bit of background of the research trajectory of understanding women's needs, or more broadly, mobility and gender, and then sort of diving in or setting the stage for my esteemed colleagues to talk more about what is happening in practice. To start off, I just chose one of these, more recent surges of articles that are putting the issue right in front of us, saying that all too often women in transport are an afterthought. And with that said, what is the evidence that we can turn to, at least from a North American context? So I present three key documents that in my work, well, the two I refer to very commonly, and then the work that we did in Canada, but these have motivated me, inspired me to really dive into this research topic. And one of those being the work about the pink tax on transportation, which I'll talk more about, which is looking at how safety issues affect how women are using the system and how it results in a greater cost burden for women. And then the second one, which is, such a, again, inspiration in terms of my work and the work of so many others, is that landmark report by LA Metro, Understanding How Women Travel. And then in 2022, myself and a few colleagues produced the report, Understanding and Responding to the Transit Needs of Women in Canada, which really dove deep into the Canadian patterns and issues. But the very interesting part is that there's been a really interesting resurgence in the interest and topic of understanding women's experiences and uses of public transit. So we can look back to research dating from the 1970s, 80s, that started to analyze the aggregate travel data that was collected in travel diaries from developed countries to report trends in terms of how women's travel looks different than their male counterparts in terms of trip purpose, trip distance, the mode used, so women being more likely to use public transit than men, and other key aspects that affect women's travel behavior. And then we saw the work of mobility of care, coined first by Sanchez de Madriaga in the 2010s, which was, again, that pivotal work helping us move forward in this topic. And then we saw most recently in practice the LA Metro How Women Travel report, and then the Gender Action Plan, most recently in 2022. So I'm just going to talk now about what are some of these patterns that emerge in research, and what I'll follow that up with what are some of those reasonings behind what we see in terms of patterns. So one of those first patterns we see that I think has really propelled this transition from research to practice is that women are dominant public transit users in a lot of cities. So just presenting some Canadian trends we see from a journey to work perspective. So just looking at commuting data in 20, this was the 2021 data. Women are, there's about a 10% gap between men and women's use of public transit in terms of the journey to work. And then there's, this is by no means a comprehensive presentation of trends about women's transit use, but this is one of those really great pieces of evidence by APTA in 2017 showing that 55% of transit ridership are women. What else do we know? Well, there's been knowledge for decades that women are more likely to work closer to home, meaning that they have shorter commutes and have shorter annual VKT, or vehicle kilometers or miles traveled, which is important, of course, to understand, and how that affects wage and other related market outcomes for women and job satisfaction. We also know from the body of work related to mobility of care that women are more likely to trip chain and have, in many cases, more complex travel behavior and patterns. Women more likely to travel with their dependents, that might be children in strollers or younger walking age children, as well as elderly dependents with mobility restrictions. So that creates some complexity about how women navigate and use the system and their experiences of it. Also, there's emerging evidence that women travel more often at off-peak times. This is data taken from the LA Metro How Women Travel report, showing some deviations between how men and women use the system at different times of day. And I say this is emerging because, as we'll see in some of the other presentations today, smart card data has never had any information about demographics or how men or women use the system. So we're trying to understand this better. So to sum up, there is a rich body of research dating back to the 1970s that has documented these areas where the travel needs of women are distinct. So next, what I want to do is transition the conversation away from these patterns in terms of how women travel differently and use this transit system differently, to focus more on why. Why do women use the system differently? And with that further information about why, we can better understand how to positively impact women's travel behavior and experiences of transit. Before I go further, I want to position this work about understanding women's travel behavior in the context that when understanding gender and mobility, it's essential that we approach this with understanding that the individual is embedded in a household, within a neighborhood, region, and larger society. So context-specific research is just so valuable. But again, we need to understand that women's travel behavior is much more than simply the decisions that are made on a daily basis, but are affected by women's standing in the labor force, as well as status in a household. Also, with that said, gender in all its complexity and diversity certainly impacts mobility. And while I present on key trends observed in the literature, I acknowledge that these trends do not represent all lived experiences of women on transit and the unique ways in which gender and gender minorities experience travel. So I will try in certain cases to bring an intersectional lens to the research. However, this is certainly a priority moving forward to understanding women's travel. With that said, I will start to present some of the information that we have available to us that grounds or contributes to the understanding of why we see women travel differently than men. And one of those key reasons is related to the gender pay gap, which contributes to women's higher dependency on public transit for its greater affordability in relation to ownership costs of personal on mobility. So this is the Canadian chart, of course, showing the gender pay gap and how it has started to close between 1998 and 2021, sorry. And while we see the trend that it's starting to close on the vertical axis, there is that percent representing the gap between men and women's wages, annual wages. But we see in 2021 that gender gap in Canada remains just over 10%. But looking at the gender pay gap in Canada between Canadian-born women, immigrant women, and Indigenous women, we see much, much larger disparities in the gender pay gap among racialized women. So seeing, gender pay gap among Canadian-born women hovering around 10%, and then for Indigenous women, we see that is much closer to 30%, although closing. Secondly, over the course of the years, while women have participated in the labor force more and more and received or are graduating at much higher rates now from university than previously, women are still overwhelmingly responsible for the caregiving of children, elderly parents, and other relatives. So with that, the mobility of care work is such a significant contributor to women's annual hours of unpaid housework. Which presents, again, the differences between how women utilize the system and patterns between trip purposes and types of trips that are being taken in terms of the time of day and what those trips look like. And as I mentioned before, there is the trend that women commute shorter distances than men, and that's coming from the fact that women have a tendency to live closer to work. And that could be in relation to several factors, but one being the fact that, time budgets are a lot more strict among women and have to change the job search in order to find a job that is going to be more within the possible realm of caregiving work as well as other commuting-based travel. And the other potential reason as to why we see differences in women's travel behavior versus men is women having lower car priority in households, so that women, again, are more dependent on public transit for more of their travel purposes. And there's limited evidence to support these two hypotheses, but there is nonetheless some evidence to support that women have stronger environmental motivations or act more on these environmental motivations in terms of using public transit and traveling less, as well as have less attachment to cars and car ownership. So more research absolutely can help us understand the strength of these factors in affecting women's travel patterns. And of course, we have to acknowledge how safety and fear of violence is a major influence on the travel patterns of many women, especially women and gender minorities. And that really affects mobility in terms of influencing the time of travel, route of travel, as well as potentially affecting women not traveling or using other modes such as Uber or taxis to feel safer to complete travel at off-peak or late night or at night. And finally, we do know that the limited dedicated space on buses and limited sometimes access to elevators or limited predictable access to elevators affect how women use the system. And it also could contribute to women altering their travel to travel at less crowded times, knowing that there's more room to accommodate strollers. So these experiences, as well as challenges similarly experienced by older women and wheelchair users, all have implications on mobility. And this is just a example of it's the importance of analyzing which transit agencies have open stroller policies versus closed stroller policies, because certainly as a woman myself who travels with a stroller, I can't possibly imagine navigating a system with a closed stroller policy. So to sum up all of these different patterns and underlying factors helping us understand these patterns, my team created this framework that shows the interrelationship between gender roles being home or caregiving responsibilities, employment, income levels, the land use and transport system. Of course, that's complementary, and there's so many synergies between the public transit system and our land use, and how these all interplay in order to affect women's travel behavior. So to sum up, hopefully with a greater understanding of how women's travel is distinct from men, it's really important to acknowledge this mismatch between many ways in which our public transit systems are configured and services allocated, and how women are traveling or need to travel. And this imbalance can impose burdens and limitations on women's access and mobility. And this imbalance can manifest in many ways. In one way, it can further contribute to women's time poverty. So, meaning if a system just really doesn't work and support, say, trip chaining, and women are dependent on transit, that just can further affect this time penalty that women already experience related to more household work burden. So we really need to think about how we can support women in trip chaining. Another factor is that it may spatially constrain women's employment search. If transit is not very effective at connecting different communities with employment opportunities. So thinking about how a poor, disconnected public transit and land use system may result in women's constricted employment search. And lastly, as I mentioned before, it may lead to foregone travel or travel that women just do not undertake. So just to sum up this presentation, I want to again emphasize that disparities or imbalances exist for women in terms of how they travel and how historically public transit systems have been configured. And this may or may not constrain women's mobility and therefore negatively affecting women's quality of life and well-being. And to date, while this is of course changing, this awareness had not been widely translated into policy and planning. But this is a classic example of many years of academic research on mobility and gender, but it's very exciting now to see this work being absorbed into the planning practice and acted on. And just very quickly, I'll leave with two key items that are going to be talked about more in this panel today. Is the first that agencies and academic partnerships can really be leveraged to explore and test innovative data collection methodologies, in particular as it relates to ridership. So thinking about understanding patterns and then linking that to understanding why women travel the way they do. And secondly, a push is needed for gender and social identity disaggregation in data analysis, as well as visualization to understand how axes of identity affect women's travel behavior. And with that, from the Canadian context, and this extends to the American context, of course, we know that transit systems can better meet women's needs in a myriad of ways. And I really look forward to hearing more from my colleagues now about what those policies and action plans look like. So thank you very much for your attention, and I'm happy to discuss at the end of the session.
Emily, thank you so very much for that wonderful presentation, really setting the framework and kind of grounding this session. Some of the highlights, your talk about kind of the importance of questions of intersectionality, context-specific research. I know that we're going to be exploring more, not only in some of the presentations that come up, issues related to time penalties, as well as the constraints on women's employment search and the impacts that has on gender diversity in the workforce. And you wrapped up with that comment about the importance of data and partnerships. So I think we're going to not only see examples of that, but we'll also explore it more in the panel discussion after the presentation. So let's move to our next presentation. So our next presenter is Magda Khanna, who is Senior Director with Mobility Corridors Department at LA Metro. And then prior to her current role, she was a member of the LA Metro's Women and Girl Governing Council and led the groundbreaking work that Emily referenced, understanding how women travel study, which was the first of its kind by a transit agency in the United States. And she managed the Gender Action Plan for LA Metro. And she's going to talk a little bit more about these initiatives. So Magna, turning the floor over to you.
Thank you so much. And I have to say, I'm recovering from a cold. So you get this amazing voice today. Okay, I just want to make sure you all can see my presentation. Yeah. Okay, so thank you again. As Hilary mentioned, I do work in the planning department, managing various light rail projects. So in 2017, under the leadership of our then CEO, Phil Washington, and then Deputy CEO, Stephanie Wiggins, who's actually now our CEO, LA Metro established a Women and Girls Governing Council. So what this council did, it is a volunteer group of diverse group of 60 Metro employees, and it represents every department. It includes union, non-union, entry-level to executive, and it is a volunteer council. So you put in an application to be a volunteer on this council for 1 year. And in 2017, when this council was started, I was really excited to join this council. And what this council does is it applies a gender lens in 3 focus areas. Metro as an employer, what are we doing to make Metro more friendly for women to come and work at Metro and create that gender balance even among our workforce? Metro as a service provider, what are we doing to make sure that our transit system can be safer, better for women and girls who are riding our system? And I was leading this particular service provider group. Metro as a catalyst for economic development. So what is Metro doing to ensure that women-owned businesses can come and be part of those big contract opportunities that Metro put forward in terms of work related to any field? So these were the 3 service areas. And like I said, I was very fortunate to be leading the service provider group alongside the 20 other Metro employees. And as part of this group, we quickly wanted to look at changing our travel demand model, see how we can maybe ensure that travel demand model could have the women perspective. And just asking that question, we started reaching out to data managers at Metro, and we quickly found out that we were not collecting data by gender. And if we were collecting data by gender for like the customer survey, we were not disaggregating to understand what are the differences between women and men. And that's where this whole study, understanding how women travel, was born, because we quickly realized Metro's not collecting data. We don't have an understanding of how women are using a system to even make policies or program changes which can cater to women. And our CEO and Deputy CEO, especially Stephanie Wiggins, she wanted us to launch and do this study. So I was, again, managing this study. And I want to walk you through the approach we took for this study. Again, first agency to ever do such a study. So it required us to be creative in how we approached it. As you heard from the previous presenter, Emily, she talked about all the literature review. There was a lot of literature review around how women are using the system from research that had happened. So we did look at that. We also utilized some of the existing data we had in terms of the customer survey that we have done over the years. We also looked at the National Household Travel Survey just to understand from a national perspective what's happening in terms of all modes. If there is one car in the family, where is it going? So similar approach from the California Household Travel Survey, just understanding the trends when it comes to how are women traveling, whether it comes to car use or transit use. But this data set of that existing data analysis provided us a really high level idea of how women are using the system. But to understand how women are using LA Metro system, we took this unique approach where we did look at the conventional methods, we conducted focus groups. And I do want to emphasize, like, quantitative data is great, but qualitative data tells you the real stories, tells you how women actually experienced our system. So we conducted 3 focus groups, 2 with women in English and Spanish, and 1 with men. And the reason we separated women and men, because we were asking some very sensitive questions about safety, sexual harassment, and then we didn't want one group or one gender to influence the other. That's why we separated these 2 groups, asking them the same question. And I also want to mention that LA Metro team, we removed ourselves from the focus group. We were in another room listening, observing, but we did not participate to allow our riders to give us that unfiltered feedback. And I have to say, these focus groups were really eye-opening. Some women even came with their kids. And just hearing even from the kids how they enjoy spending that time traveling with their mom while taking that trip meant everything to them. So again, this focus groups, I can get into more detail as we talk about the findings, but were very, very helpful. Using the convention method of survey, we did do a survey. We actually reached out to 2,600 respondents. LA County is really big, but we oversampled women. We reached out to 400 zip codes, trying to collect that data through these very streamlined questions. But in addition to that, we knew that women are really busy. Maybe we didn't capture everybody through the focus groups and survey. So we wanted to use innovative methods of getting input from our very core group, which are these women. So we did these 3 things, which is participant observations, participatory workshops, and pop-ups. And as part of the next few slides, I want to dive deeper into these innovative methods. So for the participant observation, if you see the form on the left, we worked with our partners at UCLA, the professors. They helped us create this ethnographic form. So our team, alongside a consultant team, we wrote the LA Metro system. We took almost 2,200 hours of observation, like 117 hours of observations, where we just rode the bus and the train, and we observed when women are entering a train or a bus, where are they sitting? Are they sitting in the aisle space when it comes to the rail cars? For the buses, do they hang around and sit closer to the bus driver, or do they go in the back? Are they traveling with strollers? Are they bringing their bags? So this was a really great way of just observing women travel behaviors. And if they are coming on to the train, what are they wearing? What are they carrying? And I have to say, this gave us a really good insight into women travel behaviors. In addition, we partnered with our community-based organizations, especially an organization which works with women facing disabilities, women experiencing homelessness, and women who have varying documentation status. And by doing so, we were able to capture really our vulnerable riders. And what we did, this was like my favorite, and I can't tell you how these stories really impacted me. We gave them, as you see, all these collage making. We indulged in a collage making exercise. We gave them photographs, different tools to create a story of what their day-to-day is when they take metro system. And I can't tell you how these women feel like LA Metro is literally their home. They take pride in taking transit. Some women even said that the bus stop they use every day, they even involve themselves in making sure the bus stop is clean. So this was another way of getting really good, insightful information from women on how they use the system, what's working, what's not working. And again, I have to say some women came with their kids, so that was another great perspective. Another way of collecting information, we engaged in pop-ups. We have these three main transfer stations along our system. If you know LA Metro, Rosa Park Willowbrook is a great interface between our rail system and bus transfers. North Hollywood is similar, and El Monte is just like a big bus transfer hub. What we did, our team just went out there and we were catching people on the go as they were coming in and out of the train, their ride. And as you see, we were taking observations, asking people two simple questions. What made your ride difficult? What made your ride easy? And you see in some of the photograph, we were just taking post-it notes and putting it on the board right there. Again, really good way of getting that information right then and there because it was fresh in people's mind. People would say, oh, signage was not working, or the train was delayed, or we saw some trash on this, or there was this person bothering us. So really good way of getting that information. So after collecting all this information, we tried to disaggregate and understand how women were using our system. So for overall transit behavior, I do want to highlight this is pre-pandemic. More women were riding our public transportation than men, 51% on the rail and 54% on the bus. But you might say, oh, it's pretty close. But I also want to mention, as we started looking at the trends of our ridership, we noticed that pre-pandemic, share of female transit ridership continued to grow while male ridership continued to decrease. So again, we were seeing more female riding our system than male riders. And then 90% of these female riders use the system more than 3 days a week. And 74% of these women are making trips under 10 miles. So again, they're making really short trips. They're using our system more. And the key factor that I do want to mention, because this is personal to me, I have a little one, I take transit. 57% of female riders, they bring their children onto the transit. So again, the reason this is important because it goes back to how they are using the system. Elevators are really key because they bring in strollers, they bring in bags. So again, most of the complaints we heard about elevators are from women. So those were really, really eye-opening facts. In addition, we also saw that women are using our system during midday. So from 12 p.m. to 4 p.m., that's when more females are using our system rather than those peak periods we are so tied to. And the reason being because women are either picking up their kids from school, dropping them to school, taking their elderly parents to doctor appointments. So women are using our system during the middle day, and that's when our frequency was not matching up because our frequencies were tied to those peak periods in the morning and evening, while women were using our system during the day, so they had to wait longer for our buses. And then I'm really glad to say, and you'll hear from me later, that we have made improvement just because we discovered this. And also, women are trip chaining. They are making these small trips. You'll hear more later about mobility of care, and we saw that they're going from doctor's appointment to the daycare to the children's school, and they're making these really short trips. Talking about safety, this was the largest barrier for our women riders. I have to say we heard this from women who were even our current rider or previous riders or women who had never taken metro, that they do not feel safe. And from our survey results and even like the collected data, 60% of our female riders felt safe during the day, while that percentage dropped down to 20% at night. That is really concerning and again highlights the issue about safety, especially during the night time. And when we started talking to women about what are the changes that we could make to make a system safer, we did hear that women would like to see more presence on our system in terms of non-law enforcement presence. They said cameras were great, lighting was great, but if something was happening on the train or on the platform, they wanted someone to talk to, someone they could approach. And I think because of this, if I will talk about our transit ambassador program, we now have 300 transit ambassadors, which exactly is a direct result of understanding how women travel. In addition, now it's just talking about the comfort level women feel when they are using our vehicles. Women, as I said, even from observation, we notice women tend to travel with bags, carts, and strollers. 80% of our complaints related to strollers are made by women, especially because they don't see the elevators working, and that creates an issue. They have to lug. And also, when we were working on understanding how women travel, LA Metro had a policy that you could only bring folded strollers onto the buses. And I know this is such a challenge. Imagine juggling your child, folding a stroller, and then bringing it onto the buses. So since then, that policy has been updated. Women can bring unfolded strollers onto the buses, but now the challenge is where do they put that stroller, unfolded stroller, once they get on the bus? Because the aisles are narrow and there isn't enough space. So with the Gender Action Plan, we are addressing this concern. So with all these findings, we quickly started working on gender action plan, but we knew gender action plan would take some time. And of course, COVID happened. So while we were working on the gender action plan, some of our departments, we were already working with them. And like I said, working with our safety group, they started working on the transit ambassador program. And now this pilot has been launched. We have 300 transit ambassadors writing a system. They can provide assistance when it comes to signage. They can connect you to resources. There is a lot of success stories we are hearing from this ambassador program, especially because there has been an uptick in homelessness on our system, but we have heard really good success stories where these transit ambassadors have been able to help connect these homeless to the resources that they need. They have helped prevent some accidents that would have occurred on our system. So I'm really excited to say the Transit Ambassador Program is a direct result of understanding how women travel. In addition, as I was working on understanding how women travel study and these findings were coming, our operations group was going through a bus restructuring plan for LA Metro system. So the minute we found out that women are using our service during the midday instead of just those peak periods, operations group was able to look at bus restructuring, and I am happy to report that now all our buses, all our trains have a consistent frequency, which is throughout the day instead of just the peak periods. So that's really another great thing. I won't spend too much time on this, but I just want to also say that we have made sure we have courtesy seating decals, because that was one thing that we kept hearing from women when they come on to some of these crowded buses or train car and they're traveling with bags or they're traveling with kids. Sometimes people don't offer the seats. So we have installed some courtesy seating decals where they can point out or people can see and they can offer their seats. So those are some of the improvements that have already happened. But while these improvements were happening, we were also working on a gender action plan. And the idea was to institutionalize that culture that gender is part of everything LA Metro does, and we are not gender blind, gender neutral. We are designing policies, programs that take care of this gender. So I'm happy to report that this gender action plan, the goal is, vision is to improve those barriers for women or people who identify as women. And I do want to emphasize that by understanding that there are different groups, and especially our LGBTQ community, which has faced in the past a lot of sexual harassment or more complaints of sexual harassment. We wanted to be sensitive on how we approach our policies related to them. So our gender action plan has policies that target 4 key theme areas: safety, station stop vehicle design, fair policies, service frequency and reliability, So let me walk you through those. But before I do that, we also created what we call the gender analysis tool. And what this tool is, not a complicated software system. It's just making sure anything that happens in Metro goes through like these series of questions to ensure they can identify gender specific needs and impact on whatever they're doing. They can support and engage with marginalized genders. So if they're doing outreach efforts, make sure to engage CBOs that target these marginalized groups, especially women. And then what are the implementation and accountability? So if they change a bus route, making sure that bus route change doesn't have impact to women who need to get to a health center or a school. So this gender analysis tool just makes sure that gender is part of everything we do. And right now, I'm happy to report we are using 3 key projects as a pilot to apply the gender analysis tool. And we will be reporting to the board early next year on how things have changed because they applied the gender analysis tool. And after the goal is after this pilot period, this gender analysis tool will be applied metro-wide. So in terms of safety, there are a lot of great strategies related to camera visibilities, but I will highlight a few things that we are doing right now. Station stop design and safety assessment. So we created the checklist as you see on the right side. We are working again with the community-based organizations, and on a quarterly basis, we take our women riders and to our stations where we made some improvements in terms of lighting, or we made some improvements in terms of cleanliness, amenities, and they are actually doing the assessment to give us real-time feedback so that we can use that feedback and make further enhancements. And I'm happy to report, actually, I'm doing this assessment with our women riders in 2 weeks from now. In addition, we are also working on, I just want to highlight, promote courtesy request to stop program. As I said, women do not feel safe riding our system. So during the nighttime or during those hours, which is like from 9 p.m. to almost 4 a.m., women will be able to request, or women, or I would say anybody will be able to request a stop closer to their destination. The bus stops are generally a mile apart or half a mile apart. So what would this allow is that during the nighttime, women will be able to request the bus driver to drop them closer, so in between stops. And that program right now is currently just going through our internal legal review and operations review, and we plan to launch this next early next year. In terms of station stop vehicle design improvement, I want to highlight just a few things that we are doing. Stroller space. I'm really, really excited to report that all our new buses will accommodate for one unfolded stroller that doesn't compete with a wheelchair space. So that is happening right now, where this one stroller space where women can have that unfolded stroller, just like you see in the example in the photograph right here. But on LA Metro buses, it will be one unfolded stroller that doesn't compete with the wheelchair space. And in addition, we are actually, right now, you might have heard, there's a lot of buzz going on. We are piloting restrooms at key station locations. These restrooms were just installed, and it's a pilot for 6 months at key locations. So that again addresses concerns we heard from women traveling with kids on long distance trips. We have all done that, how stressful it is if your child has to go or use a restroom. So we'll see how this pilot goes, but really excited about that. In terms of fare policy, again, we heard the stress and burden that comes with multiple trips, and women have to pay multiple times if they're traveling for these short trips. So since then, I'm really excited to again report Metro has a fare capping program. Nobody will pay more than $5 in a day now. That's the cap. Even if it's like 10 trips, 20 trips, whatever trips you make, it's just $5 per week. And then also we've been partnering a lot with healthcare providers to ensure that our life program, which is a subsidy program, can be, we can make them aware of this. So a lot of women have enlisted in this program. I believe in just like last 6 months, we have 3,000 enrollments. So that is another success that's coming out of this. And also, last thing I would say, service frequency reliability. You heard we made that frequency adjustments. Our frequency are same throughout the day, catering to the women. And as part of this gender action plan effort, we are just evaluating it and assessing it. If changes are needed, we'll be able to work with operations team to make those changes. So before I stop, I just want to say you all are hearing this and you're saying, what can we do? Maybe we don't have enough budget or the effort or resources to do a gender action plan. But I would encourage you all. I'm sure all your transit agency or all your agencies are collecting data. But as you're collecting data, make sure you're asking the gender question. Make sure you're disaggregating to understand how you can use that information to make informed decisions. You'll be surprised once you start disaggregating, you'll start seeing these nuances, which you can then use to make informed decisions. And then above all, when you do these outreach meetings, public meetings, consider the time of the day. Avoid those meal times when women are cooking, because if you want their input, you want the participation, make sure the time accommodates their schedule. Can you accommodate for children's zones at those meetings? I have recently done some public meetings where we had a children's zone, which just means that you give them drawings, Lego pieces, something to play with so the children can be there busy while metro staff is watching them and the women can just participate in the meeting. Also think about locations. Maybe you can have your meetings at churches, farmers market, healthcare providers, schools where women are generally traveling to, and you can capture them or engage them while they are there. And then please make sure to partner with your women-based, community-based organization. They are such a great resource to make sure that women can participate in anything we do. And with that, I'll stop and I'll be happy to answer questions. Thank you.
Thank you so much, Magna. It's always so inspiring to hear about the LA Metro's work in this area. And as we transition over to the next set of presentations, I really want to, commend you on that gender lens approach, thinking of Metro as an employer, as a service provider, and as a catalyst for economic development. And I thought there was a nice synergy when you were talking about the importance of data and gathering the data with what Emily was talking about context-specific data and the innovative methods you used and the ethnographic work. And great to see the implementation of the recommended actions, which I think we'll delve into more during the panel discussion. So our next set of presenters is Daniela Schumann, who is a graduate student at Harvard University studying computer science and statistics, and Dr. Kaylee Campbell, who's strategic planning advisor in the Office of Planning at Washington Metropolitan Area Transit Authority, or as we affectionately know it as WMATA. And they will be joined later during the panel discussion by their colleague, Dr. Awad Abdelhalim, who is a researcher at the Massachusetts Institute of Technology. Their presentation will focus on a research effort to use transit fare card data to reveal women's travel behavior with a focus on mobility of care. And I'm really excited to learn about this great example of research to practice. So turning it over to our WMATA team.
Thank you, Hillary. This is a joint project with WMATA and MIT. I want to acknowledge kind of everybody on the project to start. So Daniela Schumann, Awad Abdelhalim, and I, Kaylee Campbell, are presenting today, but this is also work with Anton Stewart, Inez Sanchez de Madriaga, Jinhua Zhao, Mira Patel, and Gabriel Pincus. So thank you for having us. We'll tell you a little bit about what we're doing using transit fare card data to understand these two concepts. So I was updating my slide notes while the previous presenters were going because you covered this so nicely. So we're going to talk about mobility of care as well as women's travel, which, as you know, are related concepts but not identical. Emily did a great job introducing these and Magna building on it. So I'll just say briefly, like as a reminder, mobility of care is travel for the purpose of household related work. Mobility of care travel patterns tend to be distinct from the traditional commute. For example, dropping children off at school before going to work, taking an elderly parent to the doctor, doing your grocery shopping, what's called trip chaining. Second, we know from the literature, some of that being Emily and Magna's work, that women tend to have distinct travel patterns and preferences from the average man travel. So there's overlap between these two concepts. Women do 75% of the world's unpaid care work. So a woman is more likely to be traveling for mobility of care, but it's good to have these two concepts in mind because we build off both of them. Similar to other agencies at WMATA, there are more trips taken by women, more unique customers are women, more people in our region are women. And as Magna demonstrated, seemingly gender neutral policies such as changing your midday service frequency or your transfer policies will disproportionately affect women. Right. So we've previously had a gap in our ability to evaluate this, at the passenger trip level. With As a transit agency, we look at a lot of ridership and fare card data and use it in regular reporting. So what we set out to do in this project is to build our capacity to identify mobility of care trips and trips by women using our fare card data, kind of our bread and butter data. So I think we're the first agency to develop this kind of data pipeline that links these concepts to the smart trip data. And we did this using 3 different approaches. First, we inferred gender based on the first name of a registered card. We also identified cards that were likely traveling for mobility of care, either by trip chaining near a mobility of care destination, like a daycare, school, grocery store, or by traveling with a student, senior, or person with disability. And those 3, we have particular fare classes. We can tell which fare cards are those classes. So I'm going to turn it over to Daniela to walk you through the methodology for each component.
Thank you, Kaylee, for that introduction. So as Kaylee mentioned, I'll be going through these 3 different approaches to how we identified travel behavior by women and mobility of care travel behavior. So first approach that we used was we inferred gender using the first name. We used a subset of about 2 million registered smart trip cards, which had the name associated to the traveler ID. And then we used a third-party API to infer gender using that first name. So the methodology was 94% accurate using a smaller subset of cards of about 5,000 that were available through a customer survey. We do want to identify we did identify some biases, one being we found a lower inference rate for women, and then we also had lower confidence for classifying Black and Asian associated names. And then one other thing to mention here is that the registered cards that we used to infer gender on were not really representative of all customers. They're more likely to be fully employed individuals, which is how they get that smart trip benefit. But the results are pretty interesting. What we found is that the share of women traveling in the evening falls disproportionately. So fewer women do ride in the evenings when compared to men. And this share of women actually decreases as we go later into the evening. And this trend is similar for Metro Rail. So we calculated that if Metro were able to retain women riders in the same proportion as men riders in the evening as in the midday, it would be estimated that we'd have 1,600 or more average daily trips, which is about a 5% increase in the evening. The second approach that we used to observe mobility of care travel behavior is looking at trip chaining behavior near daycare, schools, or grocery stores. So what this particularly means is we observed travel behavior where someone got onto the system, then stopped near a mobility of care point of interest, and then got back onto the system. And so specifically our methodology was we identified bus stops that were near these mobility of care points of interest, as in daycare, grocery store, or school, and particularly within 400 meters, which is about 2 city blocks. And we found that 9% of all bus stops were identified as potential mobility of care stops, so near one of those points of interest. And then we defined a mobility of care trip as a trip that frequently trip chained at a mobility of care stop, as in frequently would get onto the system, then stop near a daycare, grocery store, or school, and then get back onto the system. So what we found is that women are indeed more likely to travel in this kind of way, especially in the mornings and in the afternoons. So just looking at stops that were near daycares here on the left side of the screen, we found that in the morning between 6 a.m. and 10 a.m., that women were 10 to 15% more likely to stop near a daycare than gender parity, than at 50% women and men. And we found a similar pattern at schools and grocery stores. And actually what's interesting here is if you look at the schools graph, there's a steep decline after 8 a.m. And that's because in DC, schools start around 8 a.m. One other important point to mention here about the methodology is that this 400 meters that we used to identify the maximum distance between a bus stop and a rail stop or a mobility of care point of interest was indeed a maximum. And actually the average point of interest to mobility of care stop distance was much smaller than that at around 105 meters. And we did find that that varied by the type of mobility of care point of interest. And out of the 260 mobility of care points of interest that we looked at, as in those daycare, schools, or grocery stores, 24 had no metro bus stop within 400 meters. That's about 9%. We also developed a quick mobility of care bus stop mapping tool, so you can look at the stops that are close to each of these mobility of care points of interest using our methodology. And then the third approach that we used to observe this kind of travel behavior is we wanted to look at accompaniment patterns. So we wanted to identify customers that regularly travel with a youth, senior, or disabled customer. And so we looked at the different fare products that were associated with these 3 types of customers. And we identified cards that frequently traveled with these fare products. And what we mean by that specifically is they traveled with these fare products 9 or more times within Q1 of 2019, which is at least 3 times per month. And we identified these pairs if they had tapped into the system within 30 seconds of each other. And now we'll go through a few slides to show the distribution over the course of the day of this travel behavior of these accompanying customers. So this blue line is the trips over the entire WMATA system. And what we found is that the student accompaniments followed the expected school start and end times, as in people who are accompanying student cards were traveling disproportionately at the beginning of the day, in the morning. And then also almost non-existent during the middle of the day. Further, we found that accompanying individuals of senior and disabled persons started typically earlier in the day, so even before that peak, and are more likely to take place in the middle of the day than other accompaniment and than all trips. And what's actually really exciting is that the previous methodology that I was mentioning, approach number 2, identified 4% of all trips were mobility of care trips. And we see that indeed there's a disproportionate number of these trips that are also identified as accompanying trips. So nearly 25% of the trips conducted by these accompanying cards are identified as the mobility of care trips using the previous approach. The other interesting finding that we found was that accompanying cards are more likely to be women, particularly as the sum of accompanying trips increases in the Q1 of 2019 that we looked at. The other interesting finding is that as accompanying trips increases, as you're accompanying, as the total number of accompaniment trips that happens within Q1 of 2019 increases, that accompanying person is less likely to be unregistered, as in more likely to be registered. All right, so these were the 3 different approaches that we used, and feel free to take a look at this slide that summarizes all of that in your own time. So to conclude, we did use these multiple approaches to identify gender or mobility of care from transit card, fare card transactions at WMATA. And we did have some limitations, but what's interesting is that all 3 of these methods do point to similar trends. And there are plenty of potential applications of using transit fare card data, which can be relevant given all of the information of the previous presenters. Those being, it's important to be able to summarize characteristics of travel by women and mobility of care trips. And then we're also able to identify bus routes and stops with the highest share of people traveling for those mobility of care trips. And then understanding how fare and service changes can differently impact caregivers or women is also something that we are able to do. And then finally, we can determine the characteristics of people accompanying individuals that are students, disabled, or seniors, and maybe identify a need for companion-specific fare products. So thank you so much. That concludes our presentation, and feel free to reach out after the panel if you have any additional questions.
Thank you, Daniela and Kaylee and Awad as well, so much. It was really interesting. And I think what struck me a lot by that presentation or the methods that you talked about was you had this incredibly massive, rich data source. You acknowledged some of the biases, but what you were still able to draw out, I think I saw on one of the slides in kind of tiny font, was it in 2019 Q1, it was somewhere in the order of 40 million journeys. And it's kind of an interesting, I don't necessarily want to say contrast, but could be a really nice synergy between these kind of innovative methods with this big data set with what LA Metro did with some of their much smaller scale with the pop-ups and those kind of approaches. So really interesting. And I think we'll probably dive in more in the panel discussion with like how WMATA is going to use this information. So let's transition to our 4th presentation. So thus far, our presentations are really focused on the North American context. And in this next presentation, we're going to move a little further afield. Keiko Porath, who's with Guil Mobility Ventures, is going to discuss research that she led in Chile on women's travel behaviors and its implications for transit. And I think we're going to see a lot of interesting parallels, but certainly some differences as well with this international South American context. So Keiko, turning it over to you. Thank you so much.
Thank you, Hilary, for the introduction. I just want to make sure that everybody knows that this is part of my master thesis. So there's a bigger context behind it. So just to understand where this research comes from is we have to understand that the sustainability development goals emphasize that transport and projects have to be social, environmental, and economically sustainable. And projects have mainly focused on the environmental and economic part, but they have left outside the social part. The SDGs for the 2030s emphasize that providing safe, affordable, and accessible transport systems for all is necessary, especially for vulnerable groups. So when we apply gender-focused view to transport planning, we can help gain more sustainable cities and also target different sustainable goals. So the context that Emily gave at the beginning is really good, but I wanted to just make sure that we understand that gender perspective in transport has been seen as solely as a woman's issue lately, but changes in society have forced to a change in how we view this issue, such as travel patterns, new migration, aging population, and women's work patterns. So this has forced women to adapt their mobility patterns to a productive mobility and reproductive mobility, where male just have the productive mobility travel patterns. So as everybody has mentioned, Sanchez de Madariaga in her groundbreaking work has provided new concepts such as mobility of care, care task change, and female immobility. And she described female mobility patterns resulting from care work. This is mainly due to the predominantly care work being carried out by women and the inclusion into the workforce for women. So generally, transport planning has been considered as technically neutral, but we have to consider that it's not actually gender neutral, but it has a differential impact between genders, creating barriers for women's participation in economic, political, and social affairs, creating gender disparities. So when we analyze transport with a gender perspective, we are not only talking about women and men, but we are analyzing a greater perspective, which includes the full population and can help other populations to be more inclusive. So as Emily put it, there's a vast research in women's and men's travel behaviors, which concludes that women have different travel patterns as men, which comes from an intersectionality of all these variables, while men only are affected by the age factors. So the intersectionality of women is greater, and they are not a homogeneous group, as Emily put it so nicely. So again, going back to Sanchez de Madariaga, and this is the inspiration for my presentation. She did a survey to capture how much of the trips were actually care work related, since the surveys are disregarding this travel motive. And she found that care work is the second most used travel motive in transit after employment. So this suggests that travel surveys have to include this motive into their surveys. So the motivation of the objective of my research is that most studies are either focused on developed countries or have generalized women as one category, leaving out this rich other factors of intersectionalities. And we have to consider that in developing countries such as Chile, the travel behaviors can be affected by many factors that we don't see in developed countries, such as really big unequal income distribution in society, that cities are highly segregated according to income, which means that people live in different parts of the city according to their income, and that there are social cultural factors according to income class. So there are different cultural factors according to the income, which means that people are affected differently in their mentality. So we wanted to analyze how different crossovers between the variables determine female mobility in order to characterize women's immobility. Our second objective is to provide a survey that is collected without the biases that underestimate care trips, such as not having a category for care-related trips, that the statistics do not include short trips on foot, and that they do not reflect chain trips as well as the polygonal trips, classic polygonal trips. So we wanted to estimate the weight that care mobility has on the overall statistics. So just as Sanchez de Madrigada did for Spain. A few of our results, because I'm not going to go deeper into the travel patterns as of mode or travel times, because they are really similar across the different countries. But I wanted to show you that the results are really similar to the ones found by Sanchez de Madrigada. Care work is 31% of the travel motives, which is really close to the work travel motive. But there's a really big gender difference where women make 33% of their trips for care-related work and men only 26%. So we also found in care task motive that in households without children, women make twice as many care-related trips as men, while in households with children, the gender difference is smaller, which is a really weird result, because we thought that in households with children, the gender difference would be bigger instead of smaller. But statistics suggest otherwise, which means that they are sharing equally the tasks. Most care-related trips are made by car or walking, with a significant difference between genders, where men use the car more than women, which is culturally related, because men, as Emily put it, have like this love or tendency to use the car more than women. Women declare to travel with children, people that need help moving, and bulky objects much more than men do, which we also saw in the LA research. And regarding chain trips, we found many results that are very similar across the countries. But I wanted to highlight that in Chile, at least, and I believe that in the rest of the countries of South America, minors are conducting care chain trips, which suggests that they do care work at home. And we saw children as small as 10, 11 years old doing chain trips, which suggests that they are starting with care work really early on, which is something we saw in our accompanying surveys, where we accompanied people, seeing that children of 11, 10 years old are picking up their small brothers and sisters and then going to buy something, making chain trips for their parents. Obviously, the car use increases for women and men when they chain trips, which is related to the easiness of being able to do chain trips easier with the car. Very interesting is that men that live in households with children have chain trips with more stages than men that live in households without children, suggesting again that there's a parity in the care work relationship between men and women. And finally, we found that the difference in number of stages in a chain trips was depending on nationality and marital status. I want to emphasize that in our survey, we added nationality questions and first population question, because we saw in the literature that this could be something important. And it actually showed that nationality has a really big impact in travel patterns, as we're going to see now. So regarding immobility, we saw that 22% of adult women do not travel during the week, compared with only 17% of men, suggesting a higher immobility of women. The number of women staying at home for housework is 9 times greater than that for men. So housework has a really big impact into the immobility of women. And finally, really important regarding ethnicity and immigration status, which is something that we were not expecting to find, but was really interesting to see in the data, is that ethnicity is influencing women's transportation use, with immigrants relying more on public transport. This population's behavior is going to impact transportation and transport planning in the future as immigration is getting higher here in Chile, and I believe in most developing countries it's happening the same. So it remains unpredictable to see how it's going to affect the transport planning and the travel behaviors of people. Non-Chilean women make trips with more chains and more trips than Chilean women, which suggests that they don't have a safety network, that they rely more on themselves than Chilean women, and that they cannot access help from somebody else to do chain trips and care-related trips. Importantly, we found that non-Chilean women and men feel more insecure than Chilean people, which could be related to racial segregation that we have here in Chile. And finally, we found that First Nation women make more daily trips, which is something that we can't really explain according to the data. So if anybody has any suggestion as why First Nation women are making more trips, would be great. So we finally wanted to make a few policy implications of our research. And this is very similar to what everybody else has said previously, is that we have to invest in sex-segregated mobility data. Like we cannot do policies and transport planning without something we're not seeing. If we don't see it and we don't measure it, we're never going to be able to plan accordingly. It's important to do gender audits of the transport infrastructure and services. Qualitative data is really rich in the findings you have. Here in Chile, we have a mobile application that helps people make I forgot the word, but where you can report what is happening with the bus. If the bus has any problems, if they didn't stop in a bus stop, etc. And we are suggesting to make this also a channel for victims and observers of sexual harassment to be able to report in the same application, to make it easier for them to report something and to make the process easier of being able to take pictures in the moment and be able to suggest that something is happening. So another important thing is training and capacity building, which many of you have already mentioned, which is first responders training for bus conductors and drivers, be able to work with the stakeholders of transportation, etc. Also communications plans and protocols on public transportation safety, which is something everybody has mentioned. But policies don't have to focus only on safety, because here in Chile, at least, gender focused on transportation is seen as sexual harassment. That's synonyms here in Chile, and they are forgetting about all the other implications of gender transport. We have seen many great examples internationally, such as on-site childcare facilities in transit stations, which I think is a great idea. Obviously, making sidewalks better. We have also seen internationally fun waiting zone for kids, so they can play while waiting for the bus or for the metro. And again, making sure that there are accessible toilets, that the waiting areas are safe, and very important, as the LA study showed, flexible timetables and services, making them according to women's travel patterns. So finally, as conclusions from our research, we have to consider that mobility studies are not considering the short trips and fragment care trips into various parts of a chain, And we saw in our research that this is the second travel motive. So it's really important to include care task as a travel motive to better understand the characteristics of our train trips of men and women. We also saw that transport planning is not neutral to gender, which means that we have to see and change how transport policies are created. Our findings highlight three important things: that there are significant inequalities between men and women. There's a greater sensitivity to the different variables for women, and the importance of immigration and First Nation status and mobility patterns, which is something that was unexpected. And as future line of research, we have provided two lines mainly. One is for immobility, and we want to see which are the obstacles that are prohibiting women from leaving their home. More than just care work, there must be another reason, which could be cultural behind it. And finally, we want to research why immigration and First Nation status is a relevant variable in mobility patterns. Thank you.
Keiko, thank you so much for that presentation and bringing your research in Chile to our conversation. I really liked how you started it with framing it around the Sustainable Development Goals and this idea that gender inclusive travel is really essential for sustainability. And I thought really a poignant result related to this idea of immobility and what those equity implications are. So let's bring folks back so we can jump back into our panel discussion. And so about 30 minutes or so. And I thought we'd start with a question. I'm always interested in knowing what inspires folks to pursue certain research topics. And I thought we might start with, just hearing briefly about what inspired each of you to pursue this line of work, or maybe even share a short story or example from your research about a personal experience from women transit riders that you found particularly poignant or inspirational. And I'm going to jump back. Emily, you started us off, so maybe you could start us off here. What inspired you to do this work on women in transit?
Really hard question, and in fact it's really changed over time. I started this work before having, I was always a very frequent transit user, and then I had a child myself and realized some of these considerable challenges in terms of trying to use transit with a child. In fact, that actually was the time where I bought my first parking pass on campus, as it just was not possible for me. But what led me to this area of research was, as a public transit planning researcher, I pretty quickly realized, as discussions with my colleagues, as service standards were, and operational dollars were allocated, there was really no information about how that affects riders and different individuals. And even as, say, new capital investments or new operational dollars are allocated across the network, and trying to understand how that impacts riders is it's just a black hole. And thinking about how gender needs to be at the forefront of that conversation was what led me here. And then learning more about, as Meghna said really nicely, about the data gaps. When I learned a lot more about that from engaging with Canadian agencies, that just got me even more motivated to continue in this space.
Thanks, Emily. Well, you mentioned Meghna, so why don't we turn and kind of continue on with Meghna. What's you joined the Women and Girls Governing Council. What was it that inspired you to do this?
I think it goes back to the days when I was in Delhi, New Delhi. I grew up in India, and New Delhi is where I went to my architecture school. So between my hostel and my college, I used to take public transit. And imagine the crowded buses there. And I cannot tell you, every day there was always some horrifying story of unwanted touches, unwanted harassment. And the worst was, and I say this now and I just like think about it, and it always brings me chills. There were times which I would not say anything because by saying something, there was no one on the bus that was going to come help me. They would actually think that there was something wrong in the way I had dressed that attracted that unwanted sexual harassment or a comment. And I remember there was an incident which really shook me to my core. And I went to my college all devastated, trying to tell one of my professors, female, and she looked at me and she said, "You know what? I know you are shaken up, but the only thing we can do is move on." So that always stayed with me, where I felt like, again, I'm being victimized for something I should not be victimized for. And that was always in the back of my mind. So moving to United States, long story short, when I came to LA Metro, I always had that perspective in mind. So even when I was managing transit projects or looking at a light rail design, a station platform, I'm like, why is the elevator there? That's creating a dark zone. Why is this vending machine being put like this? This is going to create another place for someone to hide. Even on the buses, I was always like, oh my God, I don't want to be here. So all those things were in my mind. And then the minute that application came out for Women and Girls Governing Council, I cannot tell you, within 30 seconds, I applied because I was like, this is my opportunity to bring that voice to the table and make sure the experiences I've gone through, my daughter doesn't go through that experiences. So she takes transit with me, and I know every time I take her with me, I am more aware. I am more attuned to any safety issues, and I think she can sense it. And she's like, "Mama, are you okay?" And I'm like, "No, Mama is not okay." So I just want to say it's all personal, but again, being a transit planner now, I just want to make sure that we can design a system that works for women and girls.
And that was great. Thank you so much for sharing. And I love how your lived experience is informing your work as a transit professional. So I think that's probably the case for many of us who bring our own experiences to our work and career. So how about our folks from WMATA, Kaylee, Daniela, Awad? Go in any order you want. What inspired you to do this work?
Go very quickly. Basically, I read Invisible Women, did a lunch and learn, and sort of brought it to the attention of our team. We do a lot of data, and we realized that this was a big gap. But I would second say Daniela inspired me to do this project. So maybe Daniela, you want to kind of say how you got into it and what inspires you.
What's so great is that I also read Invisible Women and was also galvanized by that chapter on how women do indeed travel differently. It's something that is not discussed as much in the public discourse. So it's really exciting to be able to have this research symposium. And I just felt that it was kind of a hidden issue. And I wanted to bring to light how women do indeed travel differently and how transit systems aren't always designed for those travel behaviors. I think personally, I have always been inspired to work on issues of equity in transit. I grew up in Seattle, which has a pretty good bus system, but I would travel on my own starting at 10 or 11, and I would always feel safer when I would see a mother with a stroller on that bus. And so making sure that those mothers with those strollers, or anyone with a stroller who's taking care of the kids, has a transit that is convenient or accessible has always been ingrained to me as something that's important. Awad, do you want to add?
I don't think I have much to add. I think similar to Kelly, Daniela's enthusiasm drew me in. I'm very passionate about transit. Don't have the lived experiences of the other folks in the panel here, but through my mom, through my sisters, I see their experiences in transit, and I want to make it better. So, having someone as enthusiastic as Daniela to lead us in this work, and doing the technical support for that is definitely something that I value quite a lot.
That's great. Thank you all. And that brings us to Keiko. You mentioned this is part of your master's thesis work. How did you come to this field?
So, similar to Meghna, I had a really terrible experience in the metro system, which made me stop using transit and I started using the car to get to work because I really felt really unsafe. I started having anxiety attacks when I was using transit because this experience really was really terrible. So when I started my master thesis, I was working at the Ministry of Transportation here in Chile, and we were not segregating that data according to gender, which was something I was recommending, and I got a really big backlash from my coworkers regarding that, which is something that should be obvious for me. It was really obvious for me that we had to ask the question, women, male, not identified, but they thought that it wasn't necessary because transport planning should not be segregating according to gender. So I saw this really big opportunity to show them that it actually is segregated according to gender, which was my main motivation, like show my coworkers that it actually is important.
That's wonderful. Thank you. And that's a really beautiful segue, actually, because, one of the things I saw or listened to across all of these presentations that struck me was this emphasis on gender data. It wasn't being collected. It wasn't being disaggregated. We weren't, either gathering the data or we weren't making use of the data in our informed decision making. So, making sure we're gathering the right information and asking the right questions, which I think is a really important part to the data gathering process when we're collecting information on gender. So maybe we could talk about why is that so important for policy and implementation. And I'm going to jump to the WMATA team first, because you've got this really big data that you're working with. So but I think everyone has a perspective to share. So Daniela, Kaylee, why is this, and Awad, why is gathering data in the right way so important for policy and implementation?
I'll take this one, and please add. So first, it's definitely not a prerequisite to taking action. I think transit agencies can do a lot to work across genders, especially with, what the other panels here have already put out. There's a lot of research and people, I think, can just start implementing. But what the data can do is help prioritize efforts. So if you want to make changes to like vehicle design to accommodate strollers, and you can only do it for 10 buses, what are the top 10 buses where strollers and women in mobility of care are traveling? Or I think a big motivation is also, avoiding negative unintended impacts. So you maybe don't think that if you change midday service that has a disproportionate impact on women and caregivers, or if you change your cost to transfer between modes, the fare burden ends up more heavily on women and caregivers. So I think that those are the places where you can just bring the data forward and bring the issue up, but I don't think that it's a prerequisite in any way. And Danielle, do you add anything, please?
Yeah, I'll just add, to second everything that Kaylee mentioned. It is absolutely not a prerequisite, but it does make our lives easier, at least as researchers, which thus makes it easier to write data-informed policy. So for this project, we did indeed have to use a third-party mechanism to infer gender based on first name, because we didn't have gender associated with each unique card ID, so we couldn't track travel behavior that way. And so we had to kind of find these workarounds to be able to identify those female travel patterns. So even though it was able to work, there were still some limitations to that approach, as we mentioned in the presentation. And so just being able to have that gender disaggregated data is an important mechanism.
Great, thank you. So how about some others on the panel? When you think about data and gathering data and asking the right questions, why has it been so important for your research on policy or implementation?
I wanted to add that it's really important to have the data to justify new investments and subsidies that the services get. Because at least here in Chile, you have to justify everything with a technical reason behind it. So if you want to increase frequency during non-peak hours, so women have less travel time and waiting time, you have to justify it. So if you don't have the data, you cannot do it.
Thank you. Meghna.
I'll just build upon it. So like LA Metro, again, we were the first transit agency, first to even question why weren't we collecting data by gender. And we had so many ideas, all these ideas about strollers, and literature reviews showed that. But as a transit agency, we had to make almost like a business case. So this collection of data showing how women are using the system, how more women are tied to a system, they are the most vulnerable and loyal riders, was very, very essential for an agency like LA Metro to make the business case to our executives, our chiefs, our board members. And I think it was an eye-opening thing. Like I said, as we were working on it, we quickly started seeing that midday travel was so essential for women. Bus restructuring was happening at the same time, and that got their attention, and they were able to adjust frequency throughout the day. So I think for LA Metro, an agency our size, it was very, very important to make the business case. And I'm so glad I've been hearing it from so many other agencies who are trying to now implement. They don't have to make the business case. I think LA Metro did that work, and they've been using, and they're taking that next step of implementing things. So I feel like maybe we did the work, on-set work for most transit agencies, including ours. And now I'm so glad people can take the next step towards implementation.
Thank you. Emily, did you want to jump in on this?
I did. And I really have much of what I wanted to say is very much in line with what was said. And absolutely, Meghna, I think that LA Metro making that case has just been so impactful for other agencies to use that evidence of moving forward. And I think, yeah, I absolutely, it helps make that business case and the evidence to make certain decisions. But it's also very impactful, I think, to have information about how women are using the system, what time of day, their patterns, in order to put women at, sort of the very top of who we should prioritize or allocate, investment dollars towards, to take the stance of overcorrecting, let's say, for many years of taking a gender neutral approach, to just really hone in on, how can this new, whether it's a BRT line or other capital infrastructure line, really go straight to improving women's travel and just really trying to overcorrect for many, 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 many years of under allocating service towards women.
Great. Thank you, Emily. So I also want to think about, as we consider transit planning and services that support women riders, I think one area of interest, and it certainly came up in several of the presentations, is that of safety. And that past research has certainly shown that transit passengers' fears and concerns about safety influence their travel decisions. And, I think I'll start with Meghna, but I'd love to hear from the others. So Meghna, you noted in your presentation that safety was the largest barrier to riding transit for women, and that your gender action plan, specifically tackles that topic, and that you mentioned some of the steps, the changes you've already implemented. So have you seen concrete change or evidence of change as a result of implementing any of those strategies? Or is there a plan to further conduct research as more strategies come, as you implement more of the strategies to evaluate their effectiveness? So kind of what's the next step? We make the changes. Have they been felt?
So Hillary, I would say, I don't know if you all have seen this in the last week. There have been articles, LA Metro ridership is 10% higher than pre-pandemic levels. So this is a big news we are seeing coming across every front. Bus, rail, we've seen an increase in ridership. And right now, our team is working to see Has it been rise in women ridership, men, or overall? So that's something that's happening. But to your point about safety, I think safety is the biggest concern for our transit riders, be it women, families, or men traveling with children. And sorry, I got distracted by a chat. So I think as Transit Ambassador Program is a direct result of that safety enhancement that we wanted to make on our system, have that more law enforcement presence. We are seeing such good feedback coming out of that ambassador program. Women feel more safer. They have someone to talk to, someone that can connect them to resources right then and there. At one of our key stations, I'm sure you might have heard, but it's called MacArthur Park. It's in the center of the city. Was known for having some issues around safety. We have implemented strategies of increasing lighting levels. We have entrance and exit plans so that there's eyes on that, more law enforcement. We are even playing music, opera music on the station platform levels, which has been met with mixed reviews. But all these efforts are leading towards us seeing that ridership change and increase in ridership. So I think safety is the key. We need to work on it. We are working on it, and we are seeing good results coming out of ridership increase, both on a bus and rail.
Thanks. So I want to continue on this discussion and bring in, you know, the kind of the international perspective as it relates to safety, because we had a question from the audience, and it's perfect timing as we're talking about safety. So, and Keiko or others who might work on international contexts, how are we starting? You've had these experiences in international environments. You've had, you know, sexual harassment, you know, negative impacts traveling in Chile, New Delhi. Meghna, you described your experience. So have there been any efforts, or do you know any of you of kind of task force or work on bringing kind of the safety issue on an international scale, looking across geographic boundaries and things like that? So Keiko, maybe start with you, and then others, please pop in and join.
Yes, there are many examples internationally. Here in Chile, we wanted to apply a gender segregated metro system because we saw it internationally in Mexico and Japan and in India, I believe. But then we decided that this wasn't really a good measure, looking at the data of Mexico, because it was generating more sexual harassment around the transit system and making women feel more insecure outside of the system. And it was more a reactive measure than a preventive measure. So there are international examples, but not all of them have to be followed, because you really have to look at your cultural reality to make sure that you're taking the approach that is really needed. So here in Chile, we are doing an approach that is for third-party people. If you see something, say something, basically. This is the approach we're taking now, which is something that was copied from Singapore, I believe, and many other countries, but mainly Singapore.
Thank you. Others?
And I can just add to it, like even when we did Understanding How Women Travel or Gender Action Plan, we had a transit agency workshop, and that included many agencies from United States, but also we tried to include agencies such as Transport for London and the Canadian Transit Agency. So that's how far we went in terms of the international dialogue that we were having. And I know there are policies that we looked at, especially talking about segregation of cars. It doesn't work for US context. So I think it's really interesting, because by segregating, you're just segregating the issue, you're not addressing the issue, and it's just attracting more people to then harass these women who are now in these segregated cars. So I think it was really good dialogue just bringing in London. They talked to us about some of the policies that have worked for us and the reasons why we were able to have discussions on why it won't work in the US context because of safety concerns or even our standards. Our standards are very different from European standards. Our ramps and ADA concerns are very, very prescriptive. So I think it was really good to have that international dialogue. But to the question that was asked, I think, yes, as we get into more implementation, maybe there's approaches that we can take, where we can have dialogue with more international transit agencies.
And I can add also one kind of anecdote on this. So I'm from Sudan originally, and I run a transit mapping initiative for Khartoum. We're working on it the last year, and as a part of it, we did a really comprehensive mobility survey. We had over like 7,000 respondents, and we asked them specifically. There are some demographic questions, but we asked about experiences, particularly around harassment on the bus system. It's only a bus system there. And I think a staggering number, I mean, I don't have the data on top of my head, maybe 80% of the women respondents reported experiencing some form of harassment. And we're actually curious about the 20% who did not report. And we found that those were significantly higher for those who filled an in-person survey rather than an online survey. So the medium also impacts the reporting of things. And I think that's something to be just considered also while collecting information in those experiences, to the point that Meghna raised earlier.
Thank you. Those were really great examples, insights, kind of on an international context, either working in international or having international efforts influence what we do here in North America. So the presentations today have really focused on women as users of our transit system and how the transit industry can improve planning and service delivery with a better understanding of women's travel behavior. But I also wanted to briefly explore workforce development and really from a couple of different perspectives, whether that is about increased representation of women within the transit industry itself and how these efforts might, inspire, influence agency level change on gender diversity, but also in terms of how the transit industry and the transit services can be a catalyst for increasing opportunities for women to more easily access employment opportunities. Because I think across all of you, you might have some different perspectives on that. Maybe I think Emily, you specifically talked about constraints on women's employment opportunities and searches. So maybe we could start with you on this topic.
Yeah, and I think, it is also fitting that we just talked about safety, because I do believe that safety is not only something that is felt by riders, but operators widely, and addressing safety on public transit, I think will have very positive effects on operators and the operational experience, as whether it's a driver or somebody working in a station. So I do put that sort of at the top of my mind, is thinking about how safety is affecting operators. Not only trying to recruit women, but also retain them in a meaningful long-term career. The other issue I think a lot about is the way that we organize split shifts in terms of bus service. That's just not conducive to women's, a lot of women's and a lot of people in general's needs in terms of their own schedules. And in many ways, a lot of operational work involves a car, as you have to get to a bus garage at a time that is not very convenient by transit, or you're working late shifts. So there's a lot of very structural components that need to be addressed in order to make the job more attractive to women and individuals with families and dependents. And then, but just from my experience also working with my local transit agency that is headed by a woman, she's the branch manager, and you just see the difference, right? She just, gender and equity are just absolutely top of mind, and the culture, I think, it's just goes from the top down, and gender equity just being such a key priority. So there's a lot of mechanisms, I think, in order to recruit and retain women, but I also see it from the why it's so important to do so.
Thank you. I had saw a couple of nods there. I wonder if we could quickly ask our folks who are representing agencies, LA Metro, WMATA, how has this work influenced change at the workforce for those agencies?
So I would start, I think, to Emily's point, I'm going to add this work, understanding how women travel, gender action plan was possible because at the helm of the agency, we had a woman, our CEO, Stephanie Wiggins. Without her support, without her marching orders, this would not have happened. And she is the reason other departments are so receptive to it, because Stephanie has that approval stamp on everything, anything we do related to this study. And also our board of supervisors has 5 women. Our LA County supervisor is all women, and they're part of Metro Board. So there's support from that level. And also, I just, again, talking about the workforce, I just want to emphasize that based on all the work that we are doing on gender perspective on the transit service provider, but we are also looking at what we can do for our employees and increase that workforce participation. I cannot emphasize enough how childcare has come over and over again. We didn't talk about it today, but I know as even like one of the policies we wanted to look at was co-locating childcare in the joint development that Metro is responsible for at the stations. And also at like our Metro Gateway building, we have a childcare facility, which has enabled me to have that peace of mind, drop my child there, go to work, pick my child up. And we have partnered with agencies like Pathway LA, which can connect our employees to childcare resources, again, enhancing that participation of women and providing them that flexibility. So I just wanted to bring that point. It's not part of the discussion today, but I think it's really essential to bring that women workforce.
Thank you. Kaylee, how about at WMATA? How does this work influence conversations at WMATA at the agency level?
I think Emily and Magna covered a lot of the same things that we're thinking about. One piece I would add is if you have more female employees and they ride transit, they can bring that perspective into the day-to-day work. That's been, I think, powerful and useful. I'll make a plug that we're working currently to put out our gender equity action plan. So please stay tuned for the work that we have proposed coming up.
Awesome. Thank you. So one of the things I thought was particularly interesting is that several of your presentations discussed this idea of mobility of care. And I thought maybe first we'll take a US perspective and then go, Keiko, to you as an international perspective. So let's start with WMATA. So you specifically discuss mobility of care as a framework for understanding gender and travel. Yet most North American agencies, they have the customer service surveys that ask about trip purpose. But what is it that about this mobility of care framework that you found helpful for framing the work that you did?
I can go ahead and answer that then.
Thanks, Danielle.
Yeah, for sure. So actually, as we had mentioned, Inez's work, Professor Sanchez de Madariaga in Madrid and across Spain on mobility of care really inspired this project. And in her work, she identified that a lot of the mobility surveys that were being put out had trip purpose and asked about trip purpose, but the categories that were listed didn't really acknowledge household-related travel. So for example, there was traveling for the purpose of work or leisure or shopping or something like this that didn't really, there was no mention of needing to do care-related travel. And so we really wanted to make sure we were taking this into our methodology, so to specifically identify trips that were traveling for the purpose of dropping off the kids or doing grocery shopping, which is also a necessary form of household responsibility. Does that answer your question?
Yeah, absolutely. Keiko, how about from an international perspective? Why was this mobility of care framework helpful for you?
I think Inés Sanchez de Madariaga has influenced our work across the different presentations. This work really represents the importance of the housework. And in the book Invisible Women, I don't know if you remember the economic impact of house care work, which is something that comes before the care trips, and how invisible women are with this work. They're not being paid, they're not being recognized socially. So that's something that it was really important for my work. Acknowledge how much of the trips are done for care-related reasons.
Awesome. Well, thank you all. We just hit our 2-hour mark. And while I think I could go on for another hour, I want to respect all of our audience members. Thank you all for the work that you're doing. You know, it is really inspiring. It is remarkable. I think we've done a huge plug for the book Invisible Women. So for those in the audience, please grab a copy and take a look. And I will turn it over to Chad. I think we've got a 15-minute break before our next panel session.
Yes, thank you, Hillary. Thank you, everybody that participated in this. We are going on a brief 15-minute break before our next session. So we'll look forward to, and again, thanks to all the panelists that participated.
Hello, everybody. Welcome to the next session here. We have on disability and transit, we have a panel of speakers here. I'll just introduce myself real quick before I introduce our panel. My name is Mark Berry, and I work with Chad at Caltrans. I'm a senior transportation planner, and I manage the Federal Transit Administration FTA Section 5310 program, which is the enhanced mobility of seniors and individuals with disabilities. So joining us on our panel today, we have Judy Shanley. Judy is a PhD and National Director of Mobility, Transportation, and Youth Transition at Easter Seals, and serves as the director of several U.S. Department of Transportation projects funded by the FTA and the National Sciences Foundation, including the National Center for Mobility Management. She manages projects and multi-million-dollar budgets, conducts research, and provides technical assistance regarding human services coordination, including mobility management and building a continuum of accessible mobility options. She's currently at Easter Seals, where she leads two research projects funded by the National Science Foundation. Shanley's work focuses on conducting research to develop strategies to collect and utilize sidewalk accessibility data consistent with ADA requirements. Judy is currently the outgoing secretary of the APTA Access Committee and the co-chair of the TRB Committee on Accessible Transportation and Mobility. Prior to Easter Seals, Shanley worked at the U.S. Department of Education, Office of Special Education Programs. She earned her PhD in Special Education from the University of Florida, an MBA and a Master's in Rehabilitation Counseling, both from Syracuse University. Also joining us on our panel is Al Benedict. Al is responsible for managing several national projects to evaluate opportunities in economic and environmental benefits related to shared mobility and integrated transportation system. He leads the creation and maintenance of SUMC, which is the Shared Use Mobility Center, their interactive mobility learning center, which includes over 1,000+ entries on mobility examples and best practices and supporting tools. Al has also helped manage research from SUMC's low-income EV car sharing pilot and provides technical support for the FTA's mobility innovation pilots. Benedict also leads several national working groups to bring a diverse group of industry leaders together to address universal mobility and mobility interoperability solutions. Also joining us is Alex Kruzhansky, and I apologize if I did not get that right. I was practicing right. That time. Okay, second time's a charm. So he's a research engineer at California Path, which he joined as a postdoctoral researcher in 2008. He's become an integral part of Path's research staff. His research interests and expertise include transportation management systems, vehicle automation, connected vehicles and infrastructure, multimodal modeling and simulation, multi-dimensional geospatial and time series data analysis, econometrics, and distributed algorithms and cloud computing. Presently, Alex is leading the project focusing on user-centric informational trip assistant for public transit users with disabilities. The ultimate goal of this is to build a system which will learn travel needs and habits and suggested optimal trip options based on available resources. It also advises about real-time events and proposes a course of actions. In addition, it also aggregates the data about the disabled demand for spatial temporal analysis and to make this data open to mobility service providers. This will help create a mobility ecosystem and optimize resource allocation to satisfy the disabled demand. And then also on our panel is Jonathan Duvall. Dr. Jonathan Duvall is a postdoctoral researcher at the University of Pittsburgh in the Human Engineering Research Laboratories. He received a bachelor's in mechanical engineering in 2010 and a master's in rehabilitation science and technology in 2013, and his PhD in rehabilitation sciences in 2018, all from University of Pittsburgh. Dr. Duvall's research involves designing and evaluating assistive technology and conducting scientific research, which increases the independence and quality of life for people with disabilities. He also co-founded PathView, I hope I pronounced that right, which evaluates and maps. I'm sorry, what did I get that right?
PathView.
PathView, okay, PathView, which evaluates and maps sidewalks and other pedestrian pathways for accessibility. So as you can see, we have a very diverse panel here, and as this is just a panel for discussions, we have a few questions, general questions to get through, and then I have some specific questions for each of the panel members. So I guess I'll throw out the first one is, what have been some of the most successful developments in improving bus boarding accessibility? And in addition, what steps can be taken to further innovate this? So I don't know if anyone wants to jump in or raise their hand or chime in.
I would say, I mean, in my years of using a wheelchair, which has been 16 years now, when I first started, trying to use public transportation, a lot of the buses still had lifts, and I think doing the lower buses with the fold-out ramp, at least as what they have in Pittsburgh, is so much easier for me getting on and off a bus than the old hydraulic or electric lifts that I had to get in the right spot and then wait and be lifted up and all those types of things. So from my perspective, I think that's one of the best things. There's still some work that could be done there because if you're being loaded at a place that doesn't have a sidewalk or a curb, they're still way too steep for the ADA guidelines of a ramp to be 1 inch high for every or 12 inches of length for every 1 inch that you're going up. Most of them, if they're not going from a sidewalk into the bus, they're way more steep than that.
One of the things, this is Judy Shanley, one of the things that we've seen improvements on in terms of boarding is the receptiveness of the driver when an individual with disability boards any transit service. Because of the education and awareness that has been provided over the years, it appears that drivers are more responsive as they need to individuals getting on the bus. One of the things that I think we still need help with is to standardize the fare card and the payment systems, which I think is part of the boarding process, because there's so many unique kinds of ways that you could pay for transit service once you're on the service. It's very confusing to individuals with disabilities. So if there was some standardized way of having fare cards, have a universal fare card system, I think that would certainly help the boarding process.
That's great, Judy, and actually a nice segue to what I was thinking about is, open data solutions and interoperability. We're seeing a lot of movement on that in a lot of demonstration projects out there, really sort of testing different ways that these systems can talk to each other to better improve coordination and payment and even getting down to sidewalk condition and availability. And so really having that interoperability across systems, and it'll be exciting to see what happens with these demonstration projects. And using the open data solutions, if they are successful, then they'll be replicable in other areas, and other agencies can pick them up. So,
Alex, do you have anything you want to add in on this one? If not, we'll skip on to the next question. Are transit agencies unified in their efforts to increase accessibility? And if not, how can this be accomplished?
I guess I could start, I want to believe that that transit agencies are unified and each has the zest for wanting to create inclusive mobility options for individuals, but I think that we have a way to go. And I think that in the research even is learning more and more about what accessibility means on transit, because as we're all unique, individuals with disabilities are unique, and even though someone may have a particular disability condition, that doesn't mean they need the same kinds of supports or accommodations or accessibility interventions. And so I think learning more about what accessibility means is really critical. And I think having providers and transit agencies and planners all think that we could do more and not just provide the minimum of the ADA, but go beyond the ADA, I think is where we need to head.
And I know just in the plug, with the 5310 program, if those of you who aren't familiar with it, it's a program that goes beyond the requirements of ADA. And when it was established, it was primarily for nonprofit agencies to fill in the gaps where public transportation isn't available or inappropriate. And it's a program that's grown quite a bit. It was merged in with another federal program about 10 years ago. And, as you all know, just the demand for that program is keep increasing. So I don't want to take up more of the time, but I just wanted to plug that in there. The stopgap, trying to help in with expanding transit for those who truly are in need of that service.
It is kind of changing the culture within an agency, and I think I was thinking about the question earlier, and there's sort of cross agency collaboration, and that's a challenge in and of itself, where they may follow ADA requirements, but really thinking that. But then even within an agency, there's making sure everyone has proper training and there's communication across all staff, from the drivers to the planners and just keeping that dialogue open to really understand what the needs of the passengers are, and it's critical to really move this forward. But it is kind of shifting the mindset.
I think, as one of the requirements to be funded in the FTA program is your project has to be part of the coordinated human services plan. And I think there's opportunities there to really expand upon some of that in the regions. I don't, I can only speak for California, but I think, maybe nationwide there could be more effort there, making more, standards of helping make coordination better and more fluid to help support this the population.
There is, Mark. The FTA, the Federal Transit Administration, is responsible for facilitating the Coordinating Council on Access Mobility, which is that federal effort that brings 11 federal agencies together to better coordinate service, not only in service provision, but monetarily, and sharing vehicles and sharing policies so that there's more efficiency and access to transportation service. So if we ever see that in reality, that's the fruits of coordination.
And Judy, just for benefit, can you repeat the name of that group?
Sure, it's called the Coordinating Council on Access and Mobility, CCAM, we call it. And the National Center for Mobility Management is really charged with helping states do that. So we'll go into a state and we'll work with state agencies related to HHS, a health and human services departments and the departments of labor and the DOTs in a state, to bring those entities together to look at the kinds of policies that they have that may facilitate or inhibit collaboration and coordination between those agencies. And it's been around since 2008. And it's, you know, there was a new strategic plan launched about a year ago, and I'm happy to send a resource that people can learn more about it. But it's a real opportunity for these agencies to get together to make transportation more available, accessible, and efficient.
Yeah. That really is kind of what it takes, is that kind of that collaboration and that cross agency perspective, because mobility, it plays such a key role in everything people do from their day-to-day lives, and from medical appointments, but also just having access to mobility to really, for quality of life is so important.
Al, may I ask, so when you talk about collaboration between agencies, can you give a specific use case or an example how agencies could collaborate, what they can exchange, or
Okay, so I'm sorry, did you say kind of an example of this
yes,
exchange?
yes,
So
yes.
one of the, that's a great question. One of the things that we've been working on is it's called the transactional data specification, and it's sort of kind of thinking about open data solutions, kind of GTF, general transit feed specification is kind of of these services. If you've ever used Apple Maps or Google Maps, the reason they're able to retrieve that information is because of that open standard. But then once that foundation is in place, there are other standards or specifications to really sort of think about. So the TDS, as we call it, it's still in piloting demonstration phase right now, but we're learning from these projects that are out there. But it aims to coordinate demand responsive transportation services across agencies and across jurisdictional boundaries. So for example, if agency X doesn't have capacity to provide a ride, that trip request we put into a system, and others that participate in that exchange will be able to have access to that information and say, oh, I can provide that trip, or and this really so it aims to really provide more access, but also a higher quality of access. It's prior to that, it's a lot of this was done on still pen and paper and telephone or even fax, and so really sort of thinking through how to provide some automation through that with at the same time I think it's particularly providing service with persons with disabilities. I think there's not necessarily a full automation. There still needs to be sort of that person on the other end that is able to intake those trips. But that's one example, and there's a lot of exciting things happening there.
And Al, did you say you're testing those out?
Yeah, we're actually working on a paper now with AARP, and we'll be publishing by the end of the year. But where there's a number of demonstrations. We're not personally testing them out. Jana Lynott, myself, who is the policy director at AARP, we convene a working group that is really kind of specialized in this demand responsive transportation coordination. And through that, we're working with these demonstration projects that are testing out the data specification. Denver or Ride-NOCO, Northern Colorado areas has one. MnDOT, Minnesota DOT has a regional mass platform that they've incorporated. So these pilots are kind of in different stages throughout the country, but there's a handful of them, and we're really trying to understand what's working, what isn't working, and really trying to build on this effort.
And that's focused on on-demand transit for individuals
or different populations.
Yeah.
I'll remember vividly, I have this in my mind, if the Federal Transit Administration about 7 years ago sent me this picture of in front of her condominium complex was 3 vans. One van was picking up a veteran to go to a Veterans Day program. The other van was picking up a passenger that was going to a workforce program, and the other was picking up an elderly person. And there was one person in each of those on-demand vehicles. And you know, it just doesn't make sense to not have an efficient use of resources. And one of the challenges is the technology piece of it and the systems that entities have to be able to do cost allocation in viable ways, in ways that can report to the National Transit Database. But the other is the will to do it. You know, agencies don't want to, they see it as giving up resources or sharing resources when resources are so limited now, you know, to have to share a vehicle with other passengers who may not be their key stakeholder. That's what's challenging. And so that's the work that we're doing, is to look at these policy barriers, whether they're real or not real, and facilitate this improved coordination.
Yeah, no, that's a great point. The TDS, you know, that particular data specification, looking at demand responsive transportation, the technology itself is there, but it's working with everyone, all the players and the stakeholders, from different agencies to the private sector, and that's where, making, bring, kind of conveying the benefits, and in both, there's benefits from both the rider, the agency, and the private sector, and that participating in this gives them, if this does evolve to a national standard, it gives them the opportunity to tap into new markets. So we're really trying to think about this holistically, and how to position it to really sort of further its its implementation across different modes and different geographies throughout the country.
Looking forward to seeing that paper. You said it's coming up with AARP.
Yep, we'll be, we have an end of year release. It's a tight schedule, but we're working hard on it. So that'll be available at the end of the year.
Okay, so maybe we'll move on to the next question then. So how can fellow riders improve the transit experience for riders with disabilities?
Just be attentive, kind of pay attention.
Am I breaking up there a little bit, Alex?
To your neighbor, as they say. Do not jump over a person.
I think we missed the first minute there. Sorry. I think we can hear you now. But
Can you hear me?
Now we can. Yeah.
Yes. Yeah, I'm sorry. We have an internet outage today, and I'm on the on the phone internet access point. So I was saying that just pay attention to your neighbor, as they say. Be attentive, and that's the main thing. Do not jump over people. So I think that's the main issue.
Be attentive and respectful of if someone needs a little bit extra time to get onto board or on board.
That's right. That's right. I mean, the biggest stress for people who have disabilities is also the fact that they are keeping the others from moving on. So they are delaying the others. And it is important when those others, they say, okay, take your time. We're not in a rush.
Or people moving in some transit facilities, if they still have the seats that fold down over where the wheelchair spot is, if somebody's sitting in that seat and then they're trying to get on, then, they or the bus driver or whoever has to ask them to move. And, sometimes that can be a bit of an issue for some people. So, I would say, if you're using one of those seats, to move to a different seat.
The other thing, this is Judy, is more and more individuals with cognitive and invisible disabilities, mental health disabilities are riding transit. And so kind of be cognizant that not everyone has a physical disability which you can see, and so be mindful of that when you're passing judgment or kind of thinking about your neighbor on a bus, that there may be some disability issues underlying some behaviors. And we're seeing more and more of that. There's a push for individuals with cognitive disabilities to be more included in society, and so you suspect that those individuals are also going to be riding transit.
The next question here is, what type of disabilities still require significant strides to be made in order to allow them an equitable riding experience? And then what research has been conducted to investigate the experience of those overlooked by the broad efforts to improve accessibility? Kind of a loaded question, loaded one.
And I think Judy kind of touched on that. The intellectual or mental health disabilities, I think, are they're it's not always as visible, and whereas the physical, there's still improvements that need to be made with persons in a wheelchair, or some of these physical characteristics of a bus stop or a rail station, but really kind of looking at wayfinding, and the ticketing process, and even how the people interact with the agent or the drivers all plays a role in that.
I think one of the things that I see more often isn't so much like new technology that needs to be developed, it's getting the technology implemented universally. In a public transit system like what we have in Pittsburgh, they're kind of constantly bringing new technologies on, but it's never going to the old buses, or something. So there's still like this system of, I never know what type of a bus I'm going to get on, like even in some cases, what type of the payment system, what type of spot they have for me. For other disabilities, like you mentioned, I have a friend who's visually impaired, and there's like a quarter of the buses that announce what bus it is that's coming up to the transit stop, and the other ones don't. So he always has to ask the bus driver of those ones, like, what bus is this? So he knows which bus he's getting on, and then has to ask the driver to remember the stop that he wants to get off at, because it doesn't announce what the stops are. So there's technology that solves all that. It just hasn't been universally implemented yet.
Great point. Yep. Yeah, I think we need more research. Because I'm an educator by background, I come from the K-12 setting. I feel like there needs to be more research regarding the predictors of whether youth who leave high school are going to use public transit. We don't have a lot of data about the factors that facilitate an individual's decision to use public transit versus another mode of transportation. And so I think that's a gap in what we need across disability groups.
I think also part of the question, I think, was it what resources are available?
Research, but resources could be good too. Yeah, either one.
Maybe I put a plug in for some work that Judy and I did in collaboration. We convened a working group with a diverse and varied sort of backgrounds, all sort of really interested in extensive experience in providing accessibility solutions, and really convened discussions to understand what the barriers are and what solutions are out there. And so the resources on the Mobility Learning Center, and also on NCMM's website. But it was where it looks into everything from technology to universal design and understanding passengers, and service and planning coordination. So
any other research that
anyone's
anyone's
to share it? Oh, sorry.
Yeah, no, that's good. And what's the name of that working group, Al?
Oh, it was a Universal Mobility Working Group, and the resource itself is called the Universal Mobility Learning Module. I can put a link to it in the chat then too. But it really looks at universal mobility and trying to universal mobility being all components of a trip need to be accessible, from the sidewalk, the way people discover service, to how they board, to the interactions with the driver, to the ride itself, and really thinking of that holistically and kind of understanding what pieces what can be done to help address some of the challenges that are out there.
Just put the link, Al, in the chat.
I will. I'll.
I did. Oh, I did.
Oh, you did.
It
Oh,
did.
great.
Yeah.
Thanks.
Yeah.
Thanks, Judy.
While you were talking.
Thank you.
Plug away, Al.
Yeah.
Yeah. It was, you know, yeah. It was a great work, and it was great working with Judy.
Labor of love.
That's right.
Actually, just shared another article that we published a few years ago on journey mapping for people with disabilities. So it was doing some in-depth interviews of like, how do you plan the trip? What do you look for when you're trying to get to, you know, the mode of transportation, riding the mode of transportation, you know, all of those types of things to look for where there might be some universal barriers that still need to be addressed. What are might be more of some of the common complaints, technologies that are out there that maybe people didn't even know that were out there yet. You know, to kind of just go through the whole process and do a journey mapping of a trip that they would typically go on.
Can you put that in the chat too, John? I see.
Yeah.
Right.
Okay. And then the other question is, are there any personal testimonies or stories or anecdotes from transit riders that inspire you to work hard for those that face challenges with accessibility?
So I was working, this is Judy, I was working with a school district on helping them access transportation supports for youth with disabilities as they left high school. And one young man said to me, you know, I just want to be spontaneous. I want to go to the movies. I want to go to the parks with my friends. And I can't do that reliant on some modes of transportation. And so the term spontaneous choice became common for me to talk about when I do workshops and stuff, because we all want to have that choice of mobility options, and we want to have it be in real time and spontaneous. So spontaneous choice is what he said.
I probably have too many examples of my own personal experience with transportation. But I can give you one story that kind of brings in a lot of different modes of transportation. So I was going to a conference in Dallas, and I was thinking, you know, well, Dallas is a very large city, you know, I'm sure they have accessible taxis and stuff, and, you know, I can find a way to the hotel once I get down there. So I fly down there and get off the plane and go to like the taxi stand and stuff and start asking about like accessible taxis, and nobody has any idea of what I'm talking about. Like I call Yellow Cab or, you know, any of the big names I can think of. Nobody has anything. And like everyone keeps saying, have you tried Uber or Lyft and stuff? And I was like, you know, well, unless they have it, their newer program in this town, there probably aren't any accessible vehicles in Uber or Lyft for a power wheelchair either. So I'm there with my mom. She's coming with me as a caregiver, and I told her just to take a regular taxi, go to the hotel, and I'd find some way to get there. So the next thing I do is I find the public transportation. They had a bus that came to the airport. I was able to, you know, get the ticket or whatever I needed to do to pay for the bus, got on the bus to go over to their rail station. I guess at least there around Irving, Texas. It was primarily like a rail station that they use for their public transportation. So I got on that, found the closest you know, stop to the hotel I was trying to get off, and at that point it just starts raining like crazy. I'm still about a mile away from the hotel. So I start going on the sidewalks as far as I can. Then all of a sudden the sidewalk ends, and I come to find out I like find a bar or something, go under an awning, looking at my phone, trying to figure out exactly where I am and where I'm trying to go and everything. And it turns out that the hotel I was going to, the only actual even vehicle entrance to it is it's like off of a interstate exit ramp. And so what had actually ended up happening was a guy at the bar went in and got in his vehicle and came out behind me, and I drove out on the interstate on ramp to get to the hotel, and he was following me in his car with his lights flashing.
Yeah, see, I think that's awful, and probably happens more than, you know, maybe it'd be interesting to capture some of those stories and just because I think that gets lost a lot of times, and why this is so important. And you know, thank you for sharing. You know, I think
and especially with, you know, traveling to other cities, like most people think of, you know, transportation around their own city, you know, and stuff, but you know, with my career and everything, I do a lot of travel, and I'm always trying to figure out transportation in other cities. So that kind of lends to, you know, the discussion we had earlier too about universality between different agencies and transportation, so I know what to expect when I'm getting there, because it's universal.
Yeah. John, this is Judy. Could a human service organization like Easter Seals or the Center for Independent Living in the city that you're going to, could they be helpful in helping you identify accessible transportation modes?
Again, if it was planned ahead, probably.
Yeah.
But you know, at that point, I was kind of thinking that it wouldn't be a problem, you know,
Yep.
making assumptions. But on the other hand, you know, that also goes somewhat against the spontaneous travel.
Yeah.
You know,
Yeah.
if I have to plan ahead. So,
Yeah.
Yep. Oh.
Okay. So now we'll move on to the directed questions. So I know we have about a little over 10 minutes here. So I'm gonna do one question or so each, and then see if we have more time. Um, I'll start with you, Judy. How has your experience working in special education impacted your research in transit?
You might think there's not a connection, but there is a connection. I think of three things. Number one, in education, in special education particularly, the Individuals with Disabilities Education Act requires that educators think about the inclusiveness and least restrictive environments. So students are educated in non-segregated ways and inclusive settings. And so I think I carry that into transportation and research that's being done. Is I always want to think about the most inclusive opportunities for people. And secondly, in education, we question all of the interventions that we put in place, right? You want students to have the best outcomes. You want the programs and interventions to be the most effective. And often in the transportation sector, agencies are putting in new interventions without any empirical evidence that aligns it with their needs and with the outcomes they want. So I think my experience as an educator has made me a critical consumer, maybe to always push the field to identify those practices that have the best evidence. And then thirdly, in education, we're all about interdisciplinary work and working with a broad range of professionals, related service professionals like occupational therapists and physical therapists, to have the best outcomes for the students that we serve. And that's very much related to the Coordinating Council on Access and Mobility work that I'm doing now, because that work supposes that there's varying perspectives that are going to be at the table to influence the services. So I think in those three ways, my special ed background has really, hopefully, facilitated my efficacy as a transportation professional and TA provider. So thanks.
Awesome. And then I'll jump over to Alex. So what role does information processing play in the ridership experience of those with disabilities?
This is the project Joshua and I, my colleague Joshua and I, are involved with right now. I hope you can hear well. And what we heard today, several key points that I would like to re-emphasize. spontaneity, and what Judy said, you know, we people with disabilities want to feel kind of part of the community. They do not want to be segregated into a separate line and kind of treated in a different fashion. They want to kind of seamless. They want to have the process kind of work seamless for them, more or less, as much as possible. And what we are trying to do, much of it is about information, about what to do if things do not go according to my plan. And for that, we started developing the so-called digital assistant. So it would be like, we call it digital Jeeves, if you like. It would be an app on your phone that would tell you what to do when you go from point A to point B in as spontaneous as possible way. And at some point you may get stranded, or you are caught in the rain and you don't know where to hide when you are doing your transfer and things like that. Somebody asked about the examples. I had a personal example. I'm myself am in a wheelchair because several years ago I broke my neck diving. So and I had the following experience. My car was locked in the garage in San Francisco. So we had a concert in the symphony, and then we went out for a dinner because I met a friend there. It was a spontaneous decision, and nobody thought that, hey, the garage closes promptly at midnight. And then I came at 12:05. A person who didn't speak English was already closing the gate. I said, hey, wait a second. He was so scared that he ran away, and so my car was locked. And at that point I was 20 minutes from home. That was across the bay. But at that point I could not get home, so I had to stay at the hotel. Taxis, they would all say, oh yeah, we're coming for you. And for an hour and a half I was waiting on the street. Nobody came. So and these kind of situations create anxiety in people. So John is one of those, I would say, reckless travelers who just goes to Dallas without and say, hey, of course, I will find something. But most people do not, and they are anxious. They stay home. They avoid travels. They're not just spontaneous, but even planned. And so we try to create information gathering. And part of it is learning from people who are brave, like John, so who can actually share these anecdotal evidence. We want to have the digital knowledge base that would become an advisor for you. So don't be afraid. If you are in this crazy situation that you didn't want to end up with, here's what you can do. So that's what we are after right now in our research.
Okay, great. And then, John, I had this like a specific one. To put you on the spot here, ask you about what type of what are you research are you working on right now for the assistive technology? Like, what are some of your big findings, or what's any nuggets right now that you've been able to glean?
Yeah, well, so we work on a lot of different things, but thinking of things more related to transportation. Outside of my day job, I started a company called Pathview, as was in my bio, that we're going around the country and working with cities to do essentially like an asset management of their sidewalks. So we have a little device, we drive over it, it measures the running slope, the cross slope, if there's changes in elevation and roughness of the sidewalk, and then maps it, takes pictures of it, puts it on a GIS. So basically we end up with a map of the sidewalks, and then we can use that data to do like a Google Maps of like the accessible route to get somewhere. Like there's a sidewalk going down this street, but there's no curb ramp to get off of it, so don't take that way. And so that's one of the things actually outside of my day job, like I said, that I do. But at the day job at the University of Pittsburgh in the Human Engineering Research Laboratories, we're kind of coming at some of this from the other side of making better wheelchairs that can climb curbs, that can self-level, more robotic so they can go over more obstacles and get to places where a typical wheelchair can't. But we're also doing research on transportation itself as well too. So we just got a grant from the National Institute on Disability, Independent Living, and Rehabilitation Research to look at pretty much we're focused with this grant on electric vehicle accessibility. So looking at charging stations and also how wheelchairs could get into electric vehicles because most of them have the batteries under the floor of the vehicle, and typically the modification that they make to make a vehicle a wheelchair accessible is to lower the floor. So electric vehicles aren't really being designed right now with the ability to be even made accessible. And then also looking at airline travel. So being able to ride in the airplane in the wheelchair rather than going through the horrible process of being transferred out of your wheelchair onto an aisle chair and then pushed in the plane, transferred out of the aisle chair onto the airplane seat, and then seeing them take your wheelchair away and wondering if it's going to be dropped 10 feet off the onto the runway or be damaged by the time you get there and all of those types of things. So obviously many wheelchair riders would prefer to just drive their wheelchair onto the plane, have it locked in, and get the plane going.
Well, thank you. And I know we're just about out of time. And Al, I wanted to get you a quick question here, if we can do it, Chad, here. I was really interested in this question is, how do low-income users with disabilities fit in the future of EVs? We're talking about EVs here.
Well, that's it's a good question. I think mobility, not looking at is critical in all neighborhoods, and particularly low-income neighborhoods that really often have limited mobility services, assuring that that's accessible. There's I think that the industry itself, so microtransit for itself, is moving toward accessible vehicles, but there's still a long way to go, in terms of bike share and how those things can really be using adaptive cycles, for example, to make it a reliable and consistent option for people. So just with not even layering on the EV piece itself, but California is doing some exciting work with EV technology, and through the California Air Resources Board Clean Mobility Options Program, really trying to invest in that in low-income disadvantaged communities that also don't meet air quality standards. And so there's some exciting work being done, but it's really prioritizing that and making sure there's sufficient vehicles in the fleet available in the market itself for communities that are interested in investing in EV technology. And supporting infrastructure, charging infrastructure, and everything that goes along with it. But California is really sort of leading the charge on that, and it's exciting to see, and it'll be interesting to see how other states can kind of learn from that and really adopt some of those solutions.
Like that, leading the charge, right? So no,
I was going to comment.
That was unintentional, but yeah,
unintended.
Well, I know we're a minute over, sorry, Chad, but I want to thank you all for this great discussion on questions, and then, working together to support our spontaneous choices. So thank you so much for a wonderful discussion.
Excellent.
Thanks for inviting me.
Thank you all. Thank you, Mark. Thank you, Alex. Thank you, John. Thank you, Al. Thank you, Judy. We really appreciate your taking that time out and discuss this very important topic with us. We are going to go on a brief 15-minute break. We will be back at 3:15 Eastern or 12:15 Pacific. Hello and welcome back to our final session for the Research to Practice Transit Symposium. We're happy to have our guest, Christoph Spieler, here with us, joining us from Houston. And Christoph has an extensive background in planning. He is a PE, so professional engineer, AICP, and a lead AP, as well as the director of planning at Hewitt Zollers. His recent work includes reimagining regional rail in Philadelphia, bus transformation in Boston, bus network redesign in Fort Worth, a rail station in Austin, alternative pros freeway expansion, a community vision for Galveston, commuter rail planning in Albuquerque, greenways in Houston, street design manuals for Dallas, and flood resilience in Houston. So Christoph teaches at Rice University and has served on Houston Metro's board. He is the author of Trains, Buses, and People, an opinionated atlas of US transit, which was published in 2018, with a second edition that includes Canada, published in September 2021. So we would like to welcome Christoph, and I'll turn the time over to him. Thank you.
Thank you very much. I'm honored to be here and happy to talk to a group of researchers as well as a group of practitioners. Obviously, I come very much from the practitioner side, but I also do teach at Rice University. And that gives me a chance to interact with students and definitely dip my toes in academia. So what I want to do today is talk a little bit about some of what I talk about in the book about what makes good transit, but then also talk about sort of the task ahead and what I think we need to do to have better, more effective transit systems in the United States. So where I come from on this is that I believe better transit makes better cities. Here you can see Houston, my home, and I live a life that is probably not the typical life you expect for a Houstonian. You can see here where I live, you can see where I work. I have a 10-block commute between them, and I have a light rail train that lets me make that commute. And that makes my life better every day. And to me, that's what transit is about. Transit is about making people's lives better every day. And through that, building stronger, more equitable, more resilient, more livable cities. And what I did in the book is I looked at all of those transit systems we have in the United States and Canada. The book maps out every single metro area in the United States and Canada that has looks at what their systems are, how they overlay onto population and job density, and then looks at the stats for each of those individual systems, and then really also tells the story of what each of these cities has done. What decisions did they make and how did that turn out? Which means it really gets into the messy political reality of how transit works. And then in addition to that, I have sections that sort of put US transit in context and also talk about what makes successful transit. And I actually want to start with that because I think it's incredibly important to remind ourselves of what makes transit work. The first piece, obviously, is density. We want to put transit where the people are. Here you can see a map of Honolulu, a nice dense corridor of population between the ocean and the mountains, and then a transit footprint that matches that very nicely. If we put good transit where lots of people live, we are going to get good ridership. And likewise, we have to put that transit where lots of people are going. We know that serving major job centers is critical, but equally critical is serving universities, it's serving hospitals, and it's serving all of those other trips we make in the course of a day. It's really important to remember that even though most of the work we do in measuring travel has very much been focused on home to work trips, that those are less than a quarter of the trips we make. And high ridership successful transit systems serve all those different kinds of trips. And by far the most effective way to serve them is through walkability. Every high ridership transit system in the United States builds that ridership around stops that are surrounded by pedestrian-friendly places, places where you can get off the train or off the bus and get easily to where you're going. And that's because with transit, everybody's a pedestrian or a bicyclist on at least one end of their trip. But the really high ridership systems are really catering to people who are both walking to transit and walking from transit. Connectivity is also critically important. Because again, a lot of those transit trips, the way somebody's actually arriving at that station may be on a bus. And systems that have high ridership are systems that connect all of their lines together well, that integrate bus and rail into one system rather than treating them as two parallel systems. And then when you're actually trying to get on, it's all about frequency. As Gerald Walker would say, frequency is freedom. High ridership comes from a high level of service. And if that train runs so often, every 15 minutes, every 10 minutes, every 5 minutes, that just means that transit is there for you when you need it, and you're not planning your life around it. An hourly train, for example, might put you in a situation where you have a choice of being 5 minutes late or 55 minutes early. And then travel time. How long will it actually take me to get to where I want to go? Measured to me always in terms of door-to-door travel time. This is not the speed of the vehicle that matters. This is my total trip that matters, which means this is as much about putting stations in the right places as it is about how fast the train itself runs. But getting there fast doesn't matter unless I can also get there reliably. This is what causes people to lose their jobs. If we can't get people where they're going when we said they would be able to get there, they're not going to be able to rely on transit. Then we need to make sure that service actually has the capacity to do what it needs to do. This actually is one of the easiest pieces here because of the naturally high capacity of transit to move lots of people. But we definitely have places in the United States where we need to add more of that capacity. And then some less obvious pieces. One of them is legibility. Good transit is transit that's easy to understand. We're in Santa Monica here. We can see our destination, the pier at the end of the road. We can see the path that will get us there. We can see the station, and the train is telling us where it's going. Everything we need to know, we can tell in this one image. And I think way too many of our transit systems are far too difficult to understand. And then finally, we need our transit systems to be inclusive. We need transit that welcomes everybody. And that means lots of things. It means we definitely have to think about race and what the effects of race mean for how we operate our transit systems and how we make sure everybody feels comfortable and how we make sure we're serving all of the diverse populations of our cities. It means things like wheelchair accessibility. Most of the New York subway is not accessible to somebody in a wheelchair, and that's not an inclusive system. It means things like stroller policies on buses. If I've got a kid and I'm boarding the bus, what do I need to do? And a lot of systems will tell you, no, you need to fold your stroller. So I've got one hand for my stroller, one hand for my kid, third hand for the fare card. I'm not entirely sure how that works. So the more we make our systems welcome everybody, the more people will get on board. What's notable to me about this list is that these are actually things that we know. Every transit rider can recognize all of these elements, and none of them are very difficult. I'm sure there are people in the room who've done a great deal of research on all of these, but they are all intuitive. It is really important that we have the data to back it up, but fundamentally, transit planning is not that difficult. But we are very bad at this a lot of times. Here you're mapping out rail systems compared to density. And what really strikes me is these rail lines almost look like airliners dodging thunderstorms. As soon as they get to a bit of density, they turn around and go the other way. And this isn't because we don't have smart transit planners. It's because of all of the other things that are wrapped around transit. It is because transit is inherently political. And it's because we're often not good as a region at making those decisions well. So how do we do this better? What does it look like to create better transit so that people can really access everything they need in their lives? And to me, there's a general approach here that is true for pretty much all metro areas. The first is we need to focus on frequent networks, that show up and go service that runs, I'd say every 15 minutes or better, but hopefully more frequently than that, so that I really don't need to look at a schedule and I can simply show up, when I'm showing up and I know there will be a train or a bus along soon. That wait time makes such a difference in actual travel time, especially for the shorter trips within urban cores. 5-minute frequency versus 30-minute in this sample trip is the difference between a 22.5-minute trip on average and a 35-minute trip on average. And that is something we're often missing. One of the projects we're working on right now in Philadelphia is reimagining regional rail. And here we have very, very high quality rail infrastructure in a lot of cases, electrification running through neighborhoods with high transit demand with very low frequencies of service. So you map this out on a map and looking at a bunch of different metro areas here, what you see in white is the areas you can actually get to with frequent service. And some areas have pretty good footprints there, but others look quite bad on this map. Here's mapping out the percentages, and what's notable here is the variation. Used Remix to do this, and actually look at where that service is and how many people it's serving. On the high end, we have places like Vancouver. 66% of the population of Metro Vancouver is within walking distance of every 15-minute or better all-day weekday service. New York City, 43%. Problem here isn't the city itself. That's nearly all covered with frequent service. But as soon as we get across the line into Long Island, as soon as we cross the river into New Jersey, you can see there's big gaps in that frequent network where we have a lot of population we're not serving. San Diego, 37%, doing pretty well. Salt Lake City, 28%. Los Angeles, 22%. Within LA County, we look pretty good. As soon as you get into Orange County, you can see that starts to look a lot worse. 22% in Austin, thanks to a network redesign. Only 17% in the San Francisco Bay Area, a place that has invested a lot in transit, but where that service is still missing a lot of the people who needs it. 17% in DC and Baltimore, 16% in Houston, also due to a network redesign, 15% San Antonio, 14% in Boston, where I helped think through redesigning the bus network, 14% in Phoenix, and going on down, Dallas-Fort Worth area at only 3% before their recent network redesigns. And what also stands out is how well Canada does at this. This is ridership by metro area by mode. And notice how all of the Canadian cities far outperform their peers. And that turns out to be due to one very simple reason: they operate a lot of service. Here's what that diagram looks like for Toronto, for example. And you'll see that frequent service, not just in the city, but way out into the suburbs. And you'll see very comprehensive coverage of less frequent service, serving all of those neighborhoods out there along the way. And that means we need to actually talk about transit funding, because the core of frequent service is actually having enough money to run that service. So we should be looking, are there dense places that don't have frequent service? Are there places that need 24-hour service? And are we paying and treating operators well enough to be able to retain and attract them? Once we run that frequent service, we need those reliable high capacity lines in the highest ridership corridors we have, and we do that with dedicated transit lanes. Even a lot of the projects we focused on in the United States, things like BRT in Richmond, is still held back by the segments where they have to share lanes with cars. And we know how to do this. We have places like New York City where restrictions essentially make streets bus only. We have added bus lanes in a lot of places like San Francisco, and we've done the gold standard of center running bus lanes with the minimum interference with turning traffic all over the place. Places like San Diego, places like Indianapolis, Indiana, and places like Oakland, where we have provided much better service in existing streets and really sped up those buses and gotten much more reliable service on the ground. This can also apply in other kinds of corridors. We can look at suburban services like the Orange Line in the Twin Cities, providing much faster two-way services out to suburbs, including serving a lot of those reverse commutes. So does that frequent bus have dedicated lanes, and are those dedicated lanes enforced? And then we build rail and BRT spines. To me, this is a really critical point. Effective rail systems are those that tie into the entire transit network. Here you see a map of Boston. Every thick line is one of the rail lines, and all of the thin lines are bus lines colored for the rail line that they feed into. And what you can really sense here is how each of these lines gets its own tributary area, where all of the bus routes feed in, which what that means is obviously for the rail line, you're putting a lot more ridership on that. You're making a lot better use of that infrastructure. But what it means for all of those bus riders is they get much faster trips because they're able to make part of that trip on a faster, more reliable mode. Makes for an efficient system as well as better passenger trips. And that means we need to make the right decisions early on. The most critical decisions we make in transit planning are not actually the details of an alignment. It is choosing which corridor we're going to build in the first place. And you can see that history of different decisions. A lot of the sort of Great Society era subways, things like MARTA and then the light rail that came along in the 80s and 90s, were very much focused on park and ride commutes from the outer suburbs. Now you're seeing more systems which are, again, focusing more on walkable areas in the urban core, and even more importantly, focusing on how bus connections connect into that. And we need to think through the philosophy of how a system like that works. How do we actually connect bus and rail together? And you can see real differences there. That, for example, you look at a city like Denver, and the two networks are almost independent. Where you can see there's a bus network and a rail network, and really they don't take much advantage of each other. Or you can look at systems like Houston, and what you can see here is how many of these bus routes are intersecting with rail lines, feeding into those rail lines, and how those bus routes are also then creating crosstown service that serves trips that the rail lines don't. And that comes down to some basic decision making and often political priorities. What you see in a system like Denver is that the investment got focused on relatively low ridership suburban light rail lines, while the busiest route in the system, the Colfax bus, as of today, is still buses running in mixed traffic. This is a set of priorities that isn't actually about optimizing the network or optimizing ridership. It's a much more political set of priorities about serving places that have that kind of political weight to them. And what we should be doing is building our highest capacity modes in the corridors where we have the highest ridership. That, to me, is the ultimate basis of mode choice. Is we should be using technology to provide the capacity that we need, and therefore it should be the high ridership lines that are getting those rail lines. And there are some really good examples of doing this well. Vancouver, British Columbia is replacing the busiest bus route in North America with a new subway. That's, your ridership is telling you where that service wants to be. And when we're building these corridors out, we again need to think through what kind of things are we trying to serve. And often I see these lines serving mainly downtown employment, not much else. We should be really focusing on serving all of those trips that somebody makes over the course of their life. And then when we build these lines, we know what the international best practices look like. We know what a really good subway line looks like, and we have chances to modernize our existing systems. We have chances to modernize our streetcar systems, like cities like Boston and Philadelphia are doing. We have chances to really improve our streets to make the bus service work better. And we have huge opportunities to reimagine systems like regional rail, where we can take a commuter system and really turn it into a system that serves all kinds of trips all day, every day. And then we have to design those stations so that they actually connect in to all of those bus networks that we're serving. So what are we serving with our rail or BRT lines? Are we serving downtown? Are we serving the other employment centers? Are we serving the biggest hospitals, the large campuses, the retail, the parks? Do we have grade separation or exclusive lanes everywhere? Do we run frequently? Are our fares integrated? Are the stations in the middle of activity? Are we spending our money on things that actually help the riders? And then we have to go beyond our actual urban cores and think about the other places, the suburban service. And we know historically really well how to serve transit into downtowns. We know how to serve things like university campuses and medical centers, and we know how to serve old walkable streetcar neighborhoods, but we have a lot of other places that need service as well. Some of the densest places in our cities are 1970s apartment complexes, often home to a lot of recent immigrants now. How do we provide transit service in places like that? We can't ignore them. And when you look at where low-income residents live now, they've sprawled far beyond the traditional urban neighborhoods. Here's the LA area, for example, with density of low-income residents. And notice how widespread we see that, and notice how that pattern of frequent transit service really doesn't match it. When we're talking about serving the suburbs, what we're not talking about is running through the suburbs to park and ride lots, because that's not really serving all of the mix of trips we have there. And we can see the places where that doesn't work. Here's an example in Dallas of building a brand new transit-oriented development around an existing rail station that had been located in open fields, and actually seeing ridership drop because the transit service is not good enough to actually drive those people onto the train. The midday frequency isn't good. The crosstown connections aren't good. We really need to think about serving those trips that happen within the suburbs. And that means we shouldn't be building these kind of car-oriented, park and ride-oriented systems, and instead thinking about the same things, thinking about what kind of activity we can place around those stations, and getting a little more ambitious on that. I find like a lot of the transit-oriented development in the United States, it's really remarkably low density given the value of the stations that we're serving here. We don't get a lot of these spots, that quarter mile around every station, and we have a chance to make the most of it. There are cities which are really trying to think about how suburban service works. Here in Houston, built BRT in a 1970s Edge City Employment Center with dedicated lanes right up the middle as an attempt to really grow transit ridership in a place that has never really had that transit ridership. And I'd say by far the most dramatic story in North America is Vancouver, where the skyline is now shaped by the SkyTrain system, where you have this great frequent automated rail service, and around every one of the stations you see a cluster of high-rises coming up, redeveloping single-story strip retail, often surrounded by single-family neighborhoods, into high-density mixed use, not just at one station, but at station after station across the entire system. And then incorporating things like the grocery store on the ground floor of the station so people can really live their life around that transit. And so, is there two-way, all-day frequent service to the major activity centers outside the pre-war core? And do the zoning and the land use regulations support dense mixed-use development in those places? In addition to connecting the suburbs, we need to connect between our different areas. If you look at inner city transportation in the United States, it's incredibly spotty. You have places like the Northeast Corridor in California with pretty good networks, and other places with hardly anything. And our inner city bus network, I think, is actually been rapidly decaying and reducing the amount we have here. We need to build up more of these corridors like the Hartford line that sort of link city to city with good all-day service. It's been wonderful to see Brightline in Florida create that kind of link. But it's not just about trains, it's also about how we use buses. I always like this picture because this is a bus having an identity crisis right here. But that kind of bus service is an essential part of how we link things together. And we get some really good examples like Velociraptor in Colorado of essentially intercity BRT service here. And things like Freeway Express service in Denver that lets us make these kind of fast connections from place to place, as well as just basic lifeline rural service. New Mexico does a good job covering these small towns where people definitely need to get to the big city for things like medical appointments, and we're offering a chance to do that. So Do we have that train service to other places? And then we need to integrate all of that, create those seamless connections from one to the other. Some of the highest ridership systems on the continent are the ones that really have that built in from the beginning. Things like Toronto, where subway stations are bus hubs. In some cases, you even have things like buses and streetcars running underground into the subway stations for easier transfers, particularly in the winter. And a system where those subway lines really become the core of the entire system, where every bus route in Toronto intersects a subway and gets you to that connection. And that means designing the actual connection stations well. It means thinking about how those networks tie together. It means thinking about how our fare systems work. Make this way too complicated much of the time. And it also means putting in place the governance systems that allow this. Something that, again, is often held back by politics. You look at Atlanta, and the map of transit agencies in Atlanta is a map of race and politics, much more than it is a map of transit demand. So we need to think about that. How are our fares connected? Do we have good transfer locations? Do we have timed connections? And then finally, legibility. We need to make this easy to understand and use. I love this example. This is the A line in the Twin Cities. Everything you need to know, including a name for the stop at that stop. So you just walk up to the stop and you have all the information you need. But it's not just information, it's making systems easy to understand. Here you can see a bit of St. Paul, Minnesota. Every color is a different bus route number. Every line is a different version of that bus. How are we expecting somebody who's riding transit for the first time to be able to understand that system? And so we need to think about, what are we doing to really give people the information they need? And then once we build these transit systems, let's build great cities around them. Let's develop the places that are actually friendly to transit. Let's have that new dense development, and let's make sure it turns its front door to that transit. We have immense opportunities. What you see on this map is all of the development that's happened along the light rail line in Houston, which was a high ridership line from the get-go, but also drew all of this new development in existing areas. And we've got some really beautiful examples of this, but we also have lots of cases where transit agencies are actually getting in their own way. These stations with these vast empty plazas out front that actually create a kind of moat to any of the surrounding uses. These big wide streets that make it almost dangerous to walk to those stations. So are we actually encouraging development near transit and then discouraging development away from transit? Are we putting our public services there? Is transit ultimately faster and more convenient than driving? So we can do this. We can build a United States that has much better transit systems, but that means we have to change how we actually think. Today, we're often planning infrastructure rather than service, and we should focus first on the service we're trying to provide and then think about what we need to build to provide that service. We need to focus on the actual experience of riders and what it will be like to use that service. We need to design transit for all trips, not just those white-collar commutes we've been so focused on. We need to avoid getting distracted by technology. Actually should talk a lot less about mode than we do, talk a lot more about service, and quit trying to chase whatever the newest idea is, because really what makes transit successful is the fundamentals. We should not take existing injustices for granted. We should not bake in decisions that were made decades ago that have resulted in systems that serve some people much better than others. And ultimately, we should measure accomplishment, not by how many miles of rail we built, not by how many dollars we spent, but by how much ridership we're actually getting, by how much access we're actually providing people. To me, the bottom line in the book and in transit planning is we need to focus not on trains and buses, but rather on people. So book is Trains, Buses, People, an opinionated atlas of US and Canadian transit. You will see my contact info up there. And if you want to see lots of transit opinions and train photos, you can definitely follow me on Twitter at Christoph Spieler. And with that, I would love to answer some questions.
Yes, thank you so much for your presentation, Christoph. That was very, very interesting. Loved how you integrated your specific points with pictures about this. So one thing that you really brought up that struck me was the amount of coverage that we have in some cities, and I was shocked how coverage in the San Francisco Bay Area was so low compared to other cities. For example, San Diego had a 37% coverage, whereas
Yeah.
the Bay Area had 17%, which I found remarkable, considering how everybody talks about BART up here in Northern California, but you don't hear as much about the systems in the San Diego area. I'm just curious, like, what were some of those interesting findings, and what do you think might explain some of those that some places just did really well that you wouldn't expect, and some that you would expect to do well did not do very well?
No, I mean, that's interesting. So what those are showing is the footprint of that frequent service. And I think if you look at the Bay Area, what you will see is the places where the Bay Area runs frequent transit service are, for the most part, the places that had good transit service 100 years ago. Muni runs a lot of frequent service. Muni's been running that frequent service for a century. The core of Oakland and Berkeley, places that had great streetcar networks 100 years ago, have good frequent service today. And so in the Bay Area, what I see is a retention of that service. But beyond that, I think much of Bay Area politics has been focused on the extent rather than the quality of service. It has been about saying, we want this town to have some bus service, not we want this to have good bus service. And even with BART, commuter rail, like, you see often a lot more emphasis on that sort of breadth of the service rather than things like frequency of service. And obviously, BART will never provide that much coverage by itself, and it shouldn't. That's not what it should be. It should be the spine of the rest of the system. And I think that's what San Diego is doing right, is they didn't just build out a network, they kept strengthening the bus network that connects to it. And that, again, it's about focusing on service, not just infrastructure. It's not just how many miles of something did you build, it's how much service do you actually run on it. And that disparity is ultimately reflecting different priorities and different investment decisions in different metro areas. And partially that's reflecting what political conversation are they having. I think it is also to some degree reflecting agencies and the thinking within those agencies. Like if you look at the Bay Area, for example, VTA actually bats somewhat above its weight. And I think that is an agency that has actually thought about service more than some of its neighbors have.
Interesting.
But it's also on all of us to have the right conversation. You know, it's like, what are you mapping? And I'm mapping frequency. I'm not just mapping where is there rail in the ground. Those are two very different kinds of maps.
And a lot of the technological advances that have been made in GTFS and other things, GIS, have been able to integrate a lot of that mapping a lot more easily than it was in the past to kind of see where those holes in coverage are. Want to shift gears a little bit. You mentioned the land use and transit aspect. I know a lot of times, as I'm out and about in large cities, they've done some things right recently by orienting buildings away from, the back end of a large parking lot, far from the road, to putting that building near the road, but there's still a large parking lot, keeping the density fairly low. Though we are starting to get a little bit from that with relaxation of minimum parking requirements. And you noted how a lot of these successful transit systems have had land development near high frequency stations. I'm wondering, what are some barriers that you see to that occurring more frequently?
I mean, I think what you just mentioned is like our continued desire to accommodate cars in all of these areas is definitely holding us back. And that's even true on station properties. It strikes me how often the park and ride lot of a station is actually a barrier to getting to that station. And that is an agency sort of basically assuming its riders will show up in a car rather than walk or bike or take a bus. And We still have parking minimums in a lot of places that still are causing us to put a lot of parking in the ground right next to good transit. But we also have things like all of our real estate development financing mechanisms, where there's an assumption that in order to get a loan for your development, you're going to need to provide that parking. So you definitely see all of these mechanisms building on top of each other. And we never should forget the degree to which this is also political. And it's been remarkable watching in the Bay Area how much pushback there has been around putting development next to BART stations, which is exactly where we want development. And our zoning is actually limiting the density around so many of our stations. And to some degree, there is a need to make that political case, that understanding of, if you don't want traffic, what you absolutely want is dense development around train stations. Because that's what the alternative looks like, not more suburban sprawl out at the edge of town.
Exactly. So you gave a lot of case studies from across North America on how transit works. And in doing so, it seems like you looked at a lot of systems, what worked and what worked across areas and what didn't work. And developing those case studies and their applicability, what were some things that you found were interesting in terms of, well, wow, this area, this made a lot of this had a lot of lessons that could easily be applied elsewhere. This area, their system is very unique. What were some of those case studies that you saw?
I mean, it was always interesting to me that, like, some of the things that, like, going in, for example, Denver's generally seen as a transit success story. Once you start actually mapping out that system, its connectivity, its ridership, it's like, you start noticing how much it misses. You start noticing, for example, how many of the major destinations in the city are simply not served by that rail system. And that's because it's a system that's very much been measured in miles when people look at it. They say, oh, they built a lot. And building a lot is not a measure of success. And what I found is there's other cities which, a little surprising, like, I mean, Buffalo, for example, has only one little light rail line, but it actually has one light rail line in the corridor where light rail is most useful. It actually has some good bus connections into that. And what really stood out to me is the systems that I think do some really good system thinking. Seattle's doing some amazing work in terms of thinking about how bus and light rail expansion work together, and taking every light rail expansion as a chance to rethink how the bus network connects to it. The Twin Cities, I think, some really good rail lines, some really good bus lines, some really good connections between them. And one of the ones that showed up in this edition of the book, Indianapolis, and how quickly they managed to get some BRT lines on the ground, and how they also integrated that with an entire redesign of their bus network. There's some really good work going on in the sort of less obvious places. And I think a lot to learn there.
Yeah, it's really interesting you mentioned about the speed, is that some places are able to get things off the ground very quickly. Some aren't. We had a previous session during this symposium about project management and building that infrastructure. What have you seen as innovative ways that transit systems have kind of broken through that red tape to find success in building projects?
I mean, that's a really good question. And I am very worried in the United States that the cost of building transit and the time it takes to build transit just keeps going up and up, which ultimately means we get a lot less transit. So there's a couple of things I see. I think one of them is you see these projects that spend a very long time in planning. And I think often that's framed as if planning is slowing down projects. That's not really the case. The planners aren't the bad guys here. The problem is we aren't building the clear political support and consensus around a project. And then we're like chasing ourselves in circles, trying to make everybody happy. So there's a degree to which this is about leadership. At some point, you just got to make the decision and build the project. And talk about how are we building it and not why are we building it. I also think that a lot of our projects are overbuilt. That when I look at, for example, a new rail station, I'm seeing these massive mezzanines. I'm seeing what feels like dramatically overbuilt facilities. I'm seeing these really big sites. And I can see like probably where every one of those ideas came from. But it feels like we don't have that realization of the more complicated we make this, the longer it will take to build, the harder it will be to maintain, the more it will cost. And that's an opportunity cost. We make a station twice as much as it ought to be. That means we're going to get half as many stations. And, you know, the irony often is that, you know, you go to a place like New York City and brand new lower ridership stations are far roomier than these stations in the core of the system that have been carrying huge crowds for 100 years. And it's like, why do we need that space? And so I think on the agencies, there's often a lack of thinking about the opportunity cost and a tendency to overbuild these things. And I think that's harming us a lot. And then I also think that on the project management side, I'm a consultant, but I think frankly, one of the things we get wrong is we over-consult. I think a lot of agencies would really benefit from having a lot more expertise in-house, from having some really strong project managers who are really empowered to do their jobs well, from having key technical capability in-house, and not having to rely on consultants to do all of this. I think one of the interesting patterns is some of the countries that are best at building transit inexpensively are also the countries that actually pay their agency staff the best. Because if the most rewarding job in your profession is to work in the public sector, you are going to get better people on the public sector side. And I often see, like, I think agency capacity is actually one of the real bottlenecks we see over and over again.
Yeah, that's something that they mentioned in the previous session and in other forums that I've been in is, you know, a lot of in-house expertise. And a lot of these are, as you said, consultants saying this as well, as some of the ways to really cut down the cost and some of that red tape. I guess in the couple minutes that we have, I'm just curious, what would you say is the biggest paradigm shift in the past, say, 5-10 years that you've seen in transit and rail projects throughout North America?
I mean, the rail is interesting is in a lot of ways the projects are often lagging thinking because, you know, oftentimes the projects we're building now have been on wish lists for 30 years. Some of the shifts I have seen that I'm happy about is it does feel like there is more thinking about projects as an integrated part of a network. This is something Austin, I think, did really well. When you look at their rail system plan and see how it overlays on the bus network and realize there was really a thinking about how those two networks strengthen each other. I am also happy to see that it feels like there is more focus on all-day service. We're seeing fewer of the projects that are really peak-oriented projects, which I think is actually a very inefficient use of rail infrastructure as well as a very bad fit to how people are actually traveling. I hope we never build another peak-only commuter rail line in this country, but it actually seems like the FTA has come to the same conclusion, and you've actually been seeing some projects not move forward because they're saying, no, this really doesn't make sense from a ridership standpoint. I think it's interesting, a lot of ways COVID and work from home has just highlighted the degree to which we overemphasize 9 to 5 white-collar downtown commutes in planning our systems. We never should have been doing that. And I think COVID has just highlighted even more what a small part of trips those actually are and how many other trips we could be serving.
Absolutely. Well, with that, thank you so much, Christoph, for your time today and for your presentation. It was fascinating. We really appreciate all your effort that went into that and for sharing your experience. So, well, we are coming to a conclusion of this symposium. Thanks again to everybody that participated in it and that contributed. Let me go ahead. I'm going to share my screen and just give a final shout out. All of the people on the steering committee that worked hard in developing the graphics, getting the word out. We've had a great year, learned a lot. These will be edited so that they are all going to be on, they're online now and they will be online, but they will be edited out. So it'll be a nice clean transition and you can more easily navigate between those sessions. So in any case, we really appreciate everybody that contributed, especially our AV people at Caltrans who have been in this the whole time and are critical in making this a success. So we hope to see you again. And for now, thank you so much. Have a great rest of your day.